Good morning, everyone. I just want to check with Johanna. Johanna, are you in the Zoom room?
Yeah, I'm here. Can you hear me?
Yes.
Okay, and Live Manager has been started.
Okay, let me go there. Make sure.
And Sam, are you able to hear me as well?
Excuse me?
Are you able to hear me as well?
Yes.
Okay, great. Perfect.
Yes, I just had everything muted, so.
Very cool.
Just checking Live Manager.
Wow. That's a lot of time. Take a candy.
Okay, Live Manager's ready.
Oh, it's 9 o'clock already.
Okay.
Usual.
Chair Crandall, I
Thank you.
think we are ready to roll. Jake, are you?
Yep, all ready to go.
Okay, so Chair Crandall, we are ready when you are.
Excellent. Thank you, and welcome to the January 11th, 2022 regular Board of Supervisors meeting. We'll go ahead and do a moment of silence. Does anybody have one off the top? I do. We'll stand for Hector Urquiza, a resident of Lucerne. He is the significant or the husband to Lonnie Urquiza, who is our town council chair over in Lucerne. He has passed last week, and so he was very supportive, came to a lot of the meetings, very supportive in the community, and he was a very involved constituent of the community as well, and so supportive of his wife's endeavors when it came to the town council and any of the events taking place. So I'll give a moment of silence for him. Supervisor Scott, could you lead us in the pledge?
Sure. Ready? Begin. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Move on to item 4, consideration of extra items not appearing on the posted agenda. Are there any items to be brought forward at this time? Not hearing any, we'll move on to item 5, approval of the consent agenda. Is there any items that anyone would like to bring forward or pull from the consent agenda? Anyone from the public? And I don't have Zoom, so someone's going to have to help. I don't have Zoom up, right?
I didn't open it yet.
Yeah. Does anybody see if there's anyone on Zoom that has their hand up to pull anything from the consent agenda?
There are no hands raised in the Zoom room at present, Chairman Crandall.
Thank you very much, Matthew. If there's anyone, there's not anyone from the chambers, then we'll move forward and bring it back to the board for action.
Mr. Chair, I move to approve consent agenda 5.1 through 5.16.
Second.
I have a motion and a second. Johanna, can you conduct the roll call, please?
Okay, Supervisor Simon,
Yes.
Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Yes.
Thank you.
Bruno.
And so it's 9:03. So it looks like I went a little too fast.
You're efficient.
I think we can do 7.5. 7.5 is a consideration of the following advisory board appointments, Cobb Municipal Advisory Committee. And this is, I think, in your district, Jessica. And so is there any issues with this person that's brought forward, or do you have anything to add, or no? Anyone from the public or from Zoom? Supervisor Sabatier.
I just want to say thank you for posting the resolution along to help settle the conversation that we had, so ready to move forward.
Excellent. Anyone from the public or on Zoom that have anything to add for public input? Hearing none, we'll bring it back to the board for action.
Mr. Chair, I move that we appoint Joe Schneider to the Cobb Municipal Advisory Council.
Second?
So I have a motion and a second. Johanna, can you please conduct the roll call?
Okay, Supervisor Simon,
Yes.
Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Yes.
Thank you.
All right.
That was beautiful.
We are at 9:04. And, yeah, I don't think we should move on to those. Well, it's 9:05 now, so we'll go ahead and open it for public input. If anybody has any public input that's they'd like to bring to the board that is not covered on the agenda for today, they can come up and speak for 3 minutes as long as they say their name for the record. And just know that we as a board will not be able to address the item that you are bringing forward because it is not covered on the agenda, and we'd have to talk to it about with you about it at a different time, and more than likely we'll refer you to your supervisor or to someone that could address your issue. So is there anyone that has any public input from the board chambers? Oh, go ahead, CAO Hutchinson.
Today is the first day our new health director, Jonathan Portney, is with us, and I was going to just try to pull him in to say a quick hello. I believe he is in Zoom. And so I'm going to, Matthew, if you can promote Jennifer Baker, I believe we'll be able to have a quick greeting with Jonathan. Matthew, did you hear me?
Yes, I did, and I promoted Ms. Baker.
Thank you. We won't put you on the spot, Jen and Jonathan. Just a quick hello, if you would.
Good morning. It's a pleasure to be with you. Thank you for having me. And it's good to see you all this morning.
Welcome, Jonathan. We'll see a lot more
Thank
of you
you.
soon.
Welcome, Jonathan. And thank you for that so that people could see who we're bringing forward to help us with our
Thank you.
county. All right. Is there anything else to add to that, or no? Should I read the e-comment that was provided for public input?
You certainly can, Mr. Chair, you bet.
So there was a e-comment by Donna M., I think it's Mike Quitz, regarding the John T. Klaus Family Trust donation of property for county parks. February 9th, 2020 was discussed on accepting this large generous donation and was talked about, wondering if a decision has been made on the acceptance or denial of the gift. I have heard landowners being hesitant about donating land or conservation easements to the county, seeing how this is being handled. Looking forward to learning the status and consideration of resolution accepting bequest of real property and funds from John T. Klaus, 1994 trust to the county of Lake will be heard. I know that there's more to add to this, but because it's public input, go ahead.
I can provide just some information to your board very quickly. There had been some delay because the executor and / attorney handling this passed away,
Right.
Which means there had to be another person come on board, and we, after some difficulty, we've been able to
Right.
address that and make contact. So it should be moving forward relatively quickly.
And that's, I had that same information. Yeah, so thank you for that, Ms. Grant. So let's see. I don't see any other public input, so we'll move on to,
Mr. Chair, we do have one hand raised in the Zoom room. Jeremy Rarick.
Jeremy, go ahead and unmute yourself, and you have 3 minutes. Please state your name for the record.
Yeah, my name is Jeremy. Last name is Rarick, R-A-R-I-C-K. Hey, in the last few days, the CDC's admitted a few things about vaccines. They admitted that the vaccine does absolutely nothing to stop COVID transmission. Second, they admitted that 75% of COVID deaths had 4 or more comorbidities. And the majority of COVID deaths were people that died with COVID, not from COVID. And third, we found out that child hospitalizations were grossly over-exaggerated by over 1,700%.
Excuse me, Mr. Chair. This is on the agenda.
Yes, Jeremy, this is on the agenda. We're having a COVID update in 9:10, so if we can have you give your statements during that time of public input. All right, thank you. We'll go ahead and move forward to, unless there's no one else on Zoom. Matthew, I'm still having a hard time logging in for some reason.
There are no further hands in the Zoom room at this time. Thank you.
Okay, thank you. So we will move on to our 906 item, presentation of proclamation designating the month of January 2022 as Human Trafficking Awareness Month. And Vice Chair Scott will be reading this.
Wonderful. Welcome and thank you for joining us today. I'll read the proclamation. Board of Supervisors, County of Lake, State of California proclamation designating the month of January 2022 as Human Trafficking Awareness Month in Lake County. Whereas human trafficking is a serious crime that affects people of all races, age, and gender. Human trafficking is a borderless crime against individuals that violates the most basic human rights and deprives victims of human dignity and denies freedom to 32 million people around the world, and human trafficking is the fastest growing criminal industry globally. California ranks third amongst the states in the number of potential reports of human trafficking. And whereas a serious form of human trafficking involves the exploitation of children and youth for commercial sex acts, it is imperative that our youth and their families learn how to recognize risks and resist predators who use coercion and treats and threats to manipulate children and young adults into sex and labor trafficking. And whereas the Lake Family Resource Center has been instrumental in leading the way in the County of Lake in addressing human trafficking and providing 24-hour hotline services and continuing to support, to advocate to survivors and preventing human trafficking here in Lake County. These must include active and public efforts to help recognize and acknowledge the existence. And it is time for all of us to start the conversation, take appropriate action and support one another, and to create a safer environment for all residents. And whereas many organizations such as the District Attorney's Office, Sheriff's Office, Lakeport Police Department, Clear Lake Police Department, and Lake Family Resource Center are committed to ending human trafficking in Lake County and provide essential crisis intervention and prevention services to all members of our community. Now, therefore, it be proclaimed that this month of January 2022 is designated as Human Trafficking Awareness Month in Lake County, and our community is urging the support, the efforts of the agencies assisting victims of human trafficking, and urges all local governments, schools, businesses, and community members to be aware and report suspicious activity to local police departments to help shine a light on trafficking. Passed and adopted this 11th day of January 2022. And I'm just thankful for the Resource Center and all of the work that they do. They were instrumental in getting training here for our officers, so they were aware to what to look for. Myself, I've been through a couple of the trainings, and it's here. It's here in our communities, and we have to know what to look for to be able to help our children. And we also need to be going into the schools and as parents talking to our children of what this looks like. Because a lot of these people get caught up because they think it's a boyfriend or somebody that loves them, and before they know it, they are caught and trapped. And I'm just thankful that you ladies are here to help our survivors. And so I don't know who wants to come up and speak. And
Hi there, my name is Kara Roberts. I'm the program coordinator for the Human Trafficking Program. And Tina's right, it's here. This is happening in our county. The Human Trafficking Program is one of our newer programs. We have the domestic violence, sexual assault, other programs that have been here for years. Last year was our first year of being able to run the program, and I wanted to go over some statistics to prove that it's here to you. So in just 2021, our first year, we served 18 clients here in Lake County and offered over 1,100 services. 5 of those were labor trafficking and 13 were sex trafficking. When you think about it, it's very underreported. You know, the numbers are way higher than this, but I think it's a good start for the first year. We're doing some events for January. We have Susie Q's Donuts here in Lakeport, and they're making awareness donuts for us. They'll take a part of the proceeds and donate it back to the program. So look for the blue donuts. We had some banners made up this year. You'll see it over the Chamber of Commerce fence line. We have our human trafficking banner up there, and also in Kelseyville. We have a radio show coming up on the 20th at 2 p.m. It's on 88.1, and we'll be discussing human trafficking there as well. And we're also starting a ribbon stencil program here in the county, where we can go to the local businesses and stencil on their window, and then they sign a pledge saying that they're not going to put up with human trafficking in Lake County. So that's where we're at, you guys, and thank you for having us.
And where can somebody reach you to get that stencil put on their business if somebody was interested?
Okay, well, I have our program cards here, but you can call our community crisis line, which we have listed everywhere on our Lake Family site, Facebook, everywhere. It's 888-485-7733, and give us a call.
And that's for anybody that may be needing of assistance?
Trafficking, any kind of, assistance regarding that kind of stuff, yeah. So thank you. Thank you, board.
Great.
Thank you. Yeah, we'll have to get a picture of you all with Vice Chair Scott.
And I wore the wrong color. I ordered your donuts, not the donuts here. And I wore purple. That's your other color. That's right. We tried.
Do you want us up here with you? Yeah.
I have a pair of shoes just like this, but now with the bow. It has like all the colors.
Now this is the section of all human trafficking and domestic violence advocates. Also coordinators.
Don't want to get in front of it.
Yeah, once you get in front. Come on over. Come on over.
I'm trying to get from that, and I ended up in the...
There we go. I'm trying to get everybody in. There we go. Ready? Okay, are you smiling?
Oh, yeah.
Okay.
We're scaling, you'll never know.
Great, terrific. Thank you.
Thank you.
Oh, wait. Oh, one more phone.
Thank you, guys.
Thank you.
If you just slide it, do you know how to open it? Okay, make yourself seen.
Wait, oh, gotta get everybody in here. One more. There you go.
Thank you.
Thank you.
Any more phones?
Thank you.
Thank you very much for that. And thank you for the work that you do.
Mr. Chair?
Yes. Supervisor Sabatier.
So we just kind of put out there something that our stores can do. I'd like to see, I know we often put what, if not all the time, we put something on our social media when we have proclamations. How can we mimic what we're asking our stores to do? I'd like to see that same stencil here on our building during that month. That way, when we do a proclamation, it's not just words, like we're taking the same actions we're asking everyone else to take. So I don't know if that needs to be agendized to discuss, if that's something we want to do, but I just think that's something we should do. Because we shouldn't be asking other people to do what we're not doing. We need to be doing the same thing.
No, I agree. I agree.
I would happily put up the stencil if it can be provided to me, and I think your adoption of the proclamation is direction enough to do that.
I agree.
Great.
All right, thank you. Thank you. All right. Looks like we are at our 9:10, consideration of update on COVID-19, our 6.3 item. We do have Dr. Pace here with us on Zoom, and we are glad you're here with us to give us an update. Thank you very much for joining us, Dr. Pace, and the floor is yours.
Good morning, everybody. Good morning, Chair Crandall and the supervisors and the public. I'm Gary Pace, the interim public health officer for Lake County, and I really appreciate the opportunity to get a chance to update you on the response to the Omicron surge here now, because the situation is really changing quickly, and it's really great to get a chance to share what's going on in Lake County and what the response is here. So I do want to share you in welcoming Jonathan Portney because we're excited to have him here as our new Director of Health Services. And Sarah will be in a little later. She had a conflicting meeting this morning, so I'll do the slides, but she'll probably jump on in a little bit and can answer some questions or anything. So going to the slides, thank you for putting those up, Matthew. And so go to the next slide, please. Nationwide and in California, we're having a huge spike right now. So I think the questions that we really need to ask about are, one, how protective will the vaccine be? 2, how bad will the hospitalization and death rate be? 3, how much of the running of society is going to be impacted by this surge as it rips through? Because schools and businesses are struggling now with staffing and with sick people. And so we're not really looking at shutting down businesses, doing these sort of lockdowns like we did last year, but businesses are still ending up closing on their own just because so many of their employees are getting sick. And probably most important, what's it going to look like in Lake County? We're really sometimes, we've usually been about 2 to 3 weeks behind the rest of California when these waves move through. And sometimes the surges go by without even touching us much, and other times we get pretty heavily impacted. It's just later. But we are extremely vulnerable due to our small hospital capacity and transport issues of getting people out of the hospital. So this is the first slide here, and really it's showing Omicron. So along the bottom is time, and the orange is the Delta variant, and then the purple is the Omicron variant. Now this is not in Lake County. This is in our region, so California, Nevada, Arizona, this kind of general region. But you can see over the last couple of weeks, basically Omicron is pretty much all the infection that we're seeing. In Lake County, we haven't identified specifically any Omicron through genetic sequencing, but that's really a function of just not many samples being sent and it taking a few weeks to really get those results. And I think by the activity of what's going on and what we're seeing, this is Omicron almost completely at this point in Lake County. And so Omicron does generally seem to be a milder disease, and but it's incredibly contagious, and the spread is just really remarkable what's going on with the spread. And we've not seen anything like it before with the previous variants. And so one of the key messages, I think, is you can't really rely on your previous habits to keep you safe. So getting better masks, being more careful with social distancing, doing fewer gatherings is probably smart if you want to avoid getting it. And even though it is milder, if the hospitals get overwhelmed, we're going to be in trouble. And we're also wondering how much society is going to be impacted because of the high spread. So we don't really know the answers to these things yet, and we're kind of trying to extrapolate from other places around the world and around the country. But there's a lot of worry. There's a lot of concern about what may be coming in the coming weeks, because pretty much there's going to be a huge spread of infection, and then just how much that's going to impact everybody is just unclear at this point. The other point is that I partially agree with the person who was in the public comment thing, that previously vaccinated people can get it and spread it, although less so than unvaccinated people. And the severity does seem to be less, but just how much less, we're not 100% sure at this point. So next slide, please. So this shows the testing positivity in California, and it's a complicated slide, I know, I'm sorry about that, but it basically, I just want to give a quick feel for it. Again, this is the months along the bottom, and the main line of interest to us is Rancho, which is the red line, and you can see we are lower than the rest of the state at the current time, but it's clearly rising dramatically. And we have a test positivity in Rancho, which is our region, Northern California, of 12% right now. Next slide, please. So this is the case rate in California. Again, the similar kind of thing. So we're Rancho, again, is the red line. So we're the lowest in the different regions around the state, and but we're rising drastically now, and it's going from, so in California, it went from 15 cases per 100,000 to 132 over the last month, so it's pretty high. and it's still on the upswing now. So next slide, please. So this is looking at hospitalization and ICU rates. And this again is part of where we're getting really interested in what the impact is going to be. And I think the main thing to see is in California now and around the country, we have completely surpassed any previous hospitalization data. And in California, we're quickly approaching that. And in Sonoma County, they're getting hit fairly hard. In Lake County, we are not there yet. So hopefully we will continue to be lucky with this. And then the ICU rates are similar. They're moving up, but not nearly as fast as we've seen in previous hospitalizations. So that's probably because of the vaccination rate and possibly because of the lesser intensity of Omicron. One of the points that comes up a lot is that how much of these positive COVID patients in the hospitals are actually there because of COVID, or they're just in the hospital for other purposes. And then a COVID test is turning positive. You know, I think in some of the data, we don't have that data locally, but in Southern California, in the Bay Area, it looks like it's probably between a quarter to a third of the hospitalized cases that are entering in this COVID positive data are there for other reasons. So probably 2/3 or so are there because of COVID. But again, they're all in the hospital. They're filling up the beds. We're starting to have trouble with hospital capacity in some parts of California. Next slide, please. So this is hospitalizations by vaccine status in Lake County. And on the left side of this is since July 1st. So this kind of, unfortunately, we don't have many cases yet to get good data of Omicron, but you can see since July 1st, 85% of the folks in Lake County who were in the hospital COVID positive were unvaccinated, 15% were fully vaccinated. So, and that's kind of generally what we're seeing elsewhere. This other one on the right is really, it's from New York City, and I recognize that that's not really us. We're not in New York City, but it's important to see the trends, and so we can see how that may impact us. And so you can see along the bottom, Delta was up until the middle of December, and then Omicron started shooting it way up. And the unvaccinated are much, much higher than the vaccinated. And that seems to be what they're seeing worldwide and other places. So the unvaccinated folks seem to be the ones that are most vulnerable to getting really sick and getting in the hospital or dying. Go ahead, next slide, please. And this is another one. So this is a little bit of a conflicting information where, because again, a lot of the concern in our country is that the rates are going sky high in terms of cases, and that some of the modeling is showing that the hospital and death rates are going to go pretty high. This is one, if you look at London, which has a similar demographic to the US, and this blue line is what it looked like during the winter last year in terms of ICU bed capacity. So when they were at about where we are now, we had a similar curve, and then it started shooting way up and going to a really high rate in Great Britain, in London. And this black line here is what happened this year. So they started on the same line where we're about right now, and then the Omicron surge peaked, and then it started dropping down. So this is somewhat reassuring. Again, we don't really know what's going to happen here. This is kind of what happened in South Africa as well. So we're just trying to use this information to determine what lies ahead for us in the next month or two, and we're trying to plan for the worst but hope for the best. Next slide, please. So this is Lake County, and it's showing test positivity rate and a total test performed on the left. So you can see we're still showing quite a few tests. We're testing adequately, and then the test positivity rate is going way up here. So we're up over 20% test positivity rate, or well, it's 18.3% here, but it'll keep going up. So not a good sign. Next slide, please. So this is total confirmed cases, again, going kind of shooting up astronomically. This is Lake County. Next slide, please. So this is our epi curve that we've been looking at over the couple of years now, and it's been a very illustrative of what's going on in the county. So you can see the two different spikes we've had, and now here we are at the far right. And actually, probably by next week, this red line is going to be all the way up to the very top of the graph. We have something like 200 cases. You can see what Sarah wrote here at the bottom. There's over 200 cases still being processed, and they're probably going to go be positive. So we'll probably be up higher than we've ever been before as of this week. So, this is not something to ignore or minimize. Next slide, please. So this is recent cases by age group. You can see that the quick thing is that this is from December 12th. So this is pretty much Omicron, and the highest number of cases are in this mid-range of 18 to 49, which are the people that are working a lot and have parents of kids and things like that. Let me just see, because Sarah had written something else for me here that related to this, just some brand new information that she got together. So they were able to break down the 5 to 17-year-old age range last night, and I just got this morning. And so the 12 to 17-year-olds are probably twice as high as the 5 to 11-year-olds. So it seems like that middle school and high school age is a big part of what we're seeing. And the geographic distribution around the county is pretty much as you would expect by the population. So it's not localized in any one place. And the other piece that they had is some of the racial identification, and it pretty much mirrors the population distribution around the county. So I think what we're seeing now is real, just very, very widespread spread, and but it's definitely seems to be most prominent now in the working age, parental age of school age kids numbers. Go ahead, next slide, please. So this is the hospitalization, and this is, again, we're not being hit at this point with COVID. Our hospitals are full; they're always full, and but we're just seeing a couple hospitalized COVID patients locally. Next slide, please. So this is the vaccination question. So basically, of the cases from December 4th, which is a little early, so we're going to be seeing some Delta cases there and some Omicron. 66% of the cases, so 2/3 were not vaccinated. And so you can see unvaccinated folks are 4 times more likely to be a case than the vaccinated people. And during Delta, that was more. This is now, it's basically Omicron is able to get through the defenses from the vaccine and at least have people be infected and contagious, but it seems like it's protecting them from the serious illness. And there's a question of being previously infected and how protective that is against Omicron. I saw some data from it was Europe or South Africa that basically showed that being vaccinated, it had something like an 80% protection rate there, and being previously infected had something like a 20% protection rate. So it's not nearly as good as vaccination to have a previous infection from the little bit of information we have coming in. Next slide, please. So here's the vaccine status amongst eligible Lake County residents. So basically, again, we're 2/3 or so are pretty much completely vaccinated, and about 36% of the fully vaccinated folks have received a booster. A booster does seem to make a difference. It seems to give a fairly significant improvement in protection. Next slide, please. So this is vaccination status by age group. And I think the most interesting part of this is that even at the 65 plus, we still have 15,000 people that are unvaccinated. So those folks are incredibly vulnerable to getting quite sick. And, just remember, we have basically, in normal time, we have 8 ICU beds in the county, and we now have 15,000 plus people that are over 65 who are not vaccinated, so very vulnerable. So anyhow, thank you. You can go ahead and go back. You can end the slides. So I wanted to kind of just give a few conclusions out of this, and then I'm going to talk about the response that we have going in the county. And there's a lot going on, and just so that people know how to access services and get what they need. So vaccines do help, boosters help, and we really want to encourage people to get vaccinated and boosted. These are the conclusions from the slide that I'm doing. Will the vaccine continue to keep people out of the hospital and keep them from dying? We think so, but we're not positive yet just how good that protection is going to be, and that's kind of what we're waiting to see here. And the sheer number of cases may still fill up the hospitals and make staffing very difficult for businesses and schools, et cetera. We have an awful lot of people in Lake County that are not vaccinated. Do we have enough people vaccinated in the county to keep the hospitals from getting overwhelmed? That's from the public health point of view is one of the big questions. We've been really pushing vaccine. A lot of people feel like it's their individual right to protect themselves in whatever way they see possible, but there is a community responsibility, because if you get sick and be in the hospital, it's going to be a problem. And again, will the schools and businesses be able to stay open? So these are kind of the questions and the concerns with this huge surge coming into the county and how to do it. So what are we doing about it? What's going on in the county to try to help us not get in trouble and be protected? I think, the first part is protections. Masking is clearly helpful. Regular masks, the cloth masks, and the surgical masks are probably not as good during Omicron as they were during Delta and before. I personally am wearing an N95 whenever I'm in public or whenever I'm working, seeing patients and things like that. I really want to encourage people to use N95s as much as possible. If the cloth mask worked for you before, that's great, but it's probably not as good now as it was before, and N95 is probably the right way to go, if at all possible. You really need to stay at home if you're sick or positive. The testing, people are getting tested a lot more now, and it's good, but if you're positive, you need to stay home and not go out to the store, not go to events. The isolation and quarantine regulations have changed a lot. It's very confusing. I understand that. And we are following the CDPH, the California Department of Public Health regulations, and those are the guidelines, and those are a little stricter than the CDC ones. They require testing at the end of the 5 days of quarantine and isolation. I think if you can, people should isolate for 10 days if they can, or quarantine, but we're trying to walk this balance between allowing places to stay open and not having to shut down because they don't have enough people to staff. If you have questions about that, you can call the COVID warm line or go online, and this California Department of Public Health guidelines are there. We're expecting the businesses and the schools to follow the guidelines, and public should let businesses know that you support them following them. I think the businesses, a lot of them want to do the right thing, but if they get a lot of criticism, it becomes hard to hold to that. And I think, support the businesses that are really trying to keep the public safe. Sonoma County, just as of last night, they came out with an announcement that they're shutting down large gatherings, and they're pretty much telling everybody to stay home as much as you can for the next couple of weeks. I don't anticipate us going that route, but this is, it's important to see that this is the level of concern that we're seeing in the area. And Sonoma County is where an awful lot of our patients go when they need to be hospitalized. So it's they're kind of raising the red flag right now. And so that's just really the kind of the precautionary, the protection things. So the other parts of our response are, the first one is contact tracing. So we do have a bunch of state resources helping us to try to trace down contacts when we get positive cases. It's with this many cases, hundreds of cases, it's almost impossible to keep up with that. We're trying to focus on the schools and the nursing homes and the other congregate living situations that are very vulnerable. One of the nursing homes has an outbreak now. At least one of the other ones has a couple staff positive. So, this is it's everywhere. And these folks are very vulnerable, and they're in a closed environment. The jails and homeless shelters I think they're doing okay at this point, but it's it's an area of real concern. So testing is the third segment, and this is a lot's been changing around this, and a lot of the rules are changing. one of the, and a lot of the resources are changing. But there's two tests, the antigen test, which is the rapid test, and the PCR test, which is what we've been using a lot in the past. I think the antigen test is very good, very helpful for determining if somebody's actively contagious. And so we're using it a lot to help people see if they can come off of isolation and quarantine, or if kids are going to school, they get tested, and if they're positive on the antigen test, they need to go home because they're contagious. And so the PCR is the one that gets sent out and takes a day or two to come back, harder to get. More sensitive, so it picks it up sometimes even when people are no longer contagious. So one of the big goals with our testing, and we're trying to get the information out now about where to get tests and how to do testing, is to keep the emergency rooms open. People should not go to the emergency room just to get a test, because they are struggling to keep up, and we really want to redirect people away from going to the emergency department to get testing and to go find other ways to do it. We do on our website, we just put out a press release last week, and on our website we have some information about how to find tests and testing, and we're putting together, Rainey's putting together a one-page document that's going to have all this so that the emergency rooms and the schools and everybody can print it out and have it available for people that have questions, or direct people to the website. The schools have some antigen testing, so kids can almost always get tested if they're symptomatic or if there's some concern before having them come into the school. So they have the antigen testing there. There's some, we have a testing van that's going around the county that's doing PCR testing. So you can go on the website and find where it is at different days of the week. Unfortunately, the nurses there are sick and are out sick, and so it was closed yesterday. It'll be closed again today, and hopefully it'll be back up tomorrow. But you know, this is one of the examples of what's happening. We have the resource now, but we don't have the staffing because of people getting sick. Providers have both the PCR and the antigen testing available, so you can talk to your medical provider. The vaccine sites will be handing out antigen tests, so we have some antigen tests that are coming in from the state, and we can give those out to people. So if you can find a vaccine site that's one of the public sites, we're trying to give out antigen tests there. And some community groups have been really hard at work at trying to get testing going. And so we've been distributing tests out to some of the community groups, churches, food banks, things like that. And if you have a community group, or if you're a member of a community group that would like to get some testing to distribute to their people or to serve as a hub for some of their community, we're happy to do that. So please contact us through the COVID warm line. We have two different kinds of antigen tests. One is a big box with 40 tests in it that only has one bottle of reagent. So somebody has to sort of serve as a hub, but somebody in a neighborhood could serve as a hub, or the food bank or a church or something like that. So we really are interested in getting the tests out in the community as much as we can so that people can see when they're contagious and stay home. So that's enough about testing. So vaccines are another piece of this. Getting vaccinated now is a good thing. It's probably not going to change the course of the Omicron at this point, but we really want to encourage people to do it, and we're doing everything we can to keep vaccines available. Our new director of nursing, Eileen, has been really hard at work at trying to get a vaccine van into the county, and this is a state resource, and so we're going to get them to come back in here in about 2 weeks. And so you can keep an eye on that. So that's going to be going around the county and providing vaccines for people, boosters and first shots. The pharmacies are continuing to do it. There are some vaccine sites around the community through some of the community organizations that have been at work. And so all these things, if you go on the website, you can find some of that out. Certain medical providers are providing vaccine as well. So again, if you want to get a shot, it can be a little hard to do sometimes to navigate where it is, but if you go on our website, that's a good first start. So treatment is another piece of the response now, and you read a lot about it in the newspaper, but there's just simply not very much available. The main one that's going to be most useful, I think, is called Paxlovid. It's a pill, and it's for high-risk people that are infected but early in the course. We are supposed to get 20 courses of this from the state. We were supposed to get it at the beginning of last week, and it still hasn't come in yet. And then they're going to have a weekly supply that's supposedly going to expand in the coming weeks. We haven't seen a drop of it yet, and we'll see when we do. Northlake Pharmacy has been a really great partner, and they've been willing to do this with us and stock it. And so, you know, if you talk to your doctor and they feel like you're appropriate, once we get it in, that's where it's going to be starting off. We think Rite Aid is also interested in being part of this, and so but we're also trying to get other pharmacies to participate. So if you go and ask your pharmacy if they would participate, we'd appreciate it, because we want to get them on board with this as well. Monoclonal antibodies is another treatment option. There's very little of it in the county. We're having, you know, it comes in through the state again because there's just a limited supply around the country. And the hospitals are where to get that. So if that's something that you feel like you're a candidate for, talk to your provider. And the hospitals are trying to have some of that around, but it's very hard to get a hold of that as well. So the last part of our response really is the surge. And this is, you know, I feel like this is about the third time I've been up here talking about the surge coming in over the last 2 years. We've been really dealing with these concerning waves coming in and what it looks like and how limited our capacity is in the county. The hospitals are monitoring it, and so far we're doing really good. And but we recognize that in Lake County there's often a 3-week delay from the uptick in cases to actually getting the seeing the hospitals be impacted. And and staffing is just a gigantic issue with that. It's you know, the hospital staff gets sick and they just don't have much capacity. And, you know, there's a hardworking team of clinical people in the county, but there's just not a whole lot of folks that are not working at full tilt already. Transport is a problem as well with people that need to go to a regional hospital or for specialty care. We just always have trouble with that, especially this time of year when the weather doesn't allow the helicopters to come in sometimes. And, you know, there's also this whole issue of delaying of diagnosis and treatment for other causes. If the ER is filled up, if the hospital beds are filled up with people that are COVID and somebody has a heart attack or a stroke, they may get a delay in care, which can be devastating and, you know, really sad when that happens. So we're just encouraging people to stay out of the ER if they don't need it. If you're sick and you need to go. But if don't go just for a test or just for minor things that you can go wait till tomorrow and go to your regular doctor for. So again, if you have any questions about all this, I know this is a lot of information, but we do have the COVID warm lines open during business hours, and our website has a lot of information, and people are working hard to try to keep that up to date. So the last little part I want to just talk about is kind of thinking about the long term. We're expecting a couple more weeks of surge, and maybe it's going to be a bit longer for us here in Lake County, but you know, something like that. And the hospitalization and death rate, we just don't know, but usually that lags about 3 more weeks after that. So, you know, we're probably looking at like 6 weeks where we really have to be on edge. And then hopefully after that, hopefully by, you know, the end of February, we're going to be looking a lot better. The question here, I think, is really how to balance how to live your life with this surge. Like, should you go traveling? Should you have people over for dinner? Should you, you know, have your kids play sports? All those, and I think that's something people have to make on an individual basis. But I think as much as you can, it's a good time to lay as low as possible for the next 4 to 6 weeks, especially if you're somebody with underlying health conditions or you're not vaccinated. I think that's, you should really try to postpone things if you can. The hospitals may get overwhelmed in the coming weeks, and this affects everyone, not just the people with COVID. There are multiple reports that the death rates and the public impact on COVID have been significantly reduced over the duration of the pandemic because of some of the measures to limit spread. So what I'm trying to say there is that, you know, there's a lot of interest in looking back now and seeing how useful these things were of the shutting down the economy for a while, keeping the kids out of school, getting pushing these vaccinations. And it seems like that it has helped quite a bit, and we actually have avoided a lot more death and misery than we would have had if we hadn't done that. It's all really hard to sort through all this, but that's kind of the current thinking. So, you know, and I think eventually we're moving towards a longer term approach to living with the virus, more like we do with the flu. It's still a little too early to make this shift yet. We just don't know enough about what's going to happen with the hospitals with this Omicron variant, how well protected the vaccinated people are. But that's really the big question here, is how do we shift into kind of recognizing that COVID is just going to be part of regular life, and that we may have flares of it, but we have to kind of work with it. And we're still, I think the jury's still out on that. We're still waiting to get that information. So I think that's everything for me now. Thank you, and appreciate the chance to talk about this.
Thank you for your update, Dr. Pace. We appreciate you giving us that information. Is there any questions from the board? And I think we have Supervisor Pyska.
Good morning, Dr. Pace. Thanks for your update. I think you're right. I think we're going to learn a lot in the next few weeks. And I think we just have to recognize that and be able to continue to adapt and adjust with the data that comes to us and what we learn. I have a question about the boosters for the 12 and up. Do you know where those would be available so we can share that with the public? I'm having a hard time making that appointment with my turn, and I'm just wondering if either you or Jonathan or Jennifer has any more information on how to get that out to families.
I'm not sure, so I don't know if Eileen does or Jennifer.
Can I jump in? This is Eileen, thank you. I just received notice that in my turn, folks are able to register for sites that are giving shots to the 12 plus or the 5 to 11 immunocompromised for their boosters. And so again, if we could just direct people to our website, that site is updated every couple of times per week at minimum. And so people will be able to quickly see where they can go for what age range and what types of shots. And if appointments required or walk-ins are accepted.
Okay, I thank you, Eileen, for that, but I'm not able to make my appointment for my daughter in my turn, so maybe we can talk offline about that.
Is there any other questions? Supervisor Sabatier.
It's not a question, it's more of a comment. I just wanted to publicly thank North Lake Port Pharmacy, or maybe it's North Lake Pharmacy, not sure if I got the name right or wrong. They're the only ones right now doing open door drop-in vaccinations, and I have gone by to check that out, and it is swamped with a bunch of people looking to get vaccinations. So I think that the appointments are great, but I think that it's not enough. And I know I've had discussions over at Adventist Health. I'm checking in to see if that's changed this week. I was told that would be possible. I haven't gotten a response quite yet. But if we can get more of our pharmacies or more of our local clinics to do those drop-ins. It doesn't have to be every single day. If it could be at least one day a week all around the lake. But just to have that available in North Lakeport only, or in Lakeport only, kind of takes away from the access from a large portion of our community throughout Lake County. So I was pleased that there seemed to have been some movement, at least with Adventist Health down south, and hopefully that they do open up the door. And I actually just got a yes to my response, so that seems to be the case. But if we can look to get more, and I'm looking at our supervisors, not necessarily our public health, we have connections with those healthcare professionals, we have connections with our pharmacies. We can have those same conversations rather than asking public health to take away from what it is that they're doing, so that we can try to open up some more doors. I think that oftentimes it makes sense for appointments, but when we have people who are living in the now, and it's really difficult to make an appointment and stick with that appointment. But if you have a thought today, I want to get a shot, and you can't because you don't have transportation or access to come all the way up to Lakeport, then that's to me, that's a lost potential of somebody getting the protection that they want to get. And so that was my goal last week, was to try to open up some of those doors, and just looking at all of you to see if we can all have that same effort to try to make it as accessible as possible. So just wanted to say thank you to North Lakeport Pharmacy, just because I know that they're doing a whole lot, and I'm sure that it's tiring. And with staff shortages everywhere, I'm sure they're just as burdened by that symptom of COVID-19 as everyone else is too. So wanted to make that public appreciation.
Thank you for that, Supervisor Sabatier. I'll add to that. You're talking about North Lake Pharmacy here in Lakeport. My son finally decided to get the Pfizer vaccination, 16 and over, and I was very impressed with the amount of people that were there and how they were handling it. We tried to go to different spots, and the only place available was that pharmacy. And we got in, luckily we got in like at 11, but after that it was just people piling in to get it done. And so that's what I did want to ask Dr. Pace, was if anyone and the staff knew if some of those last week vaccinations are counted towards the amount of people, because like I said, I've heard and seen a lot of people talking about getting those vaccinations or initiating those vaccinations.
You know, I'm not sure if those are part of that. I think it's, Sarah, you're on now. Do you know where the cutoff was in terms of the addition of the new vaccine data?
The data that we showed earlier today, or this morning?
Yeah.
That is among eligible, all vaccines is among eligible residents, and then in terms of the boost.
Supervisor Sabatier, I had a question about, you mentioned something about treatment, like treatment pills. Did I hear that wrong? Or is that the same as the monoclonal antidotes or antibodies that they're talking about, or?
Right, so there's basically two different treatment options. One is monoclonal antibodies, which is given IV and needs to be given in a kind of an IV setting, either a hospital or infusion center or something like that. And most of those are not working well against Omicron, so they're kind of moving into disfavor, although there's certain situations where they can be helpful. We have very little of that in the community. There's another treatment that you've been hearing about in the news about some antiviral pills that will actually prevent the illness from getting more severe. So when somebody tests positive and they're high risk to getting very sick, then we use these pills and it cuts it by 80% or something like that from needing to be hot. 80% of the time it will improve the risk of getting infected, of having to go to the hospital. The problem is so these are the pills you hear about that the Biden administration is trying to push out and trying to order hundreds of thousands of them. But they're very limited supply right now. And so the state gets a certain amount and then they divide them up by each county gets their share, and ours is 20 courses. And we were supposed to get them a couple weeks ago, but it's been delayed, I think, because of the weather and different things. So we're going to have very little capacity. And again, North Lake Pharmacy has been our most reliable partner in working with us on this in terms of being willing to stock it and let the doctors prescribe it and them dispensing it. So another shout out to the same folks for doing that. Yeah, does that answer your question?
Yes, it does. Thank you so much. Supervisor Sabatier?
I had a question a minute ago. Oh, yes, just wanted to check in. As far as data coming from the hospitals, I know in the past it's been kind of a roller coaster where sometimes it's readily available and provided. Is there a open line of communication where you're able to obtain all of the data from the hospitals for vaccinated, unvaccinated numbers of people in ICU and hospitalization? Is that all made available directly to you, or are you only getting that through the state website?
My understanding is things are pretty good right now, but I don't know if Sarah or Eileen want to answer that.
I can provide some insight on a couple streams of data. So weekly, we receive a line list of hospitalized patients in and out of Lake County from the California Department of Public Health. That does not come direct from the 2 local hospitals, but rather from CDPH. And then there's another reporting stream through CDPH as well, but I can't speak to any local reporting.
Thank you very much.
Okay. Are there any other questions or? Okay, we'll move on to Supervisor Simon.
Thank you for all the information. As we said, always getting as much information out in the public during these trying times is very important. I think you touched on a little bit the testing capabilities in Lake County. We need to just continue to push on those. That's a big part of supporting our businesses. As you said, the Omicron variant it's coming, and I still believe that we are, Dr. Pace, like you said, 4 to 6 weeks behind the surrounding areas. I don't know what's going on. But really working on those testing capabilities. Most folks, and I think I've heard it, I haven't heard that come from you or your office, but this one is very transmissible. Most folks, vaccinated or unvaccinated, will probably get this. But we've got to keep our workforce. Our workforce has not recovered since the first pandemic, being a business owner in the county, and you've seen it around the county. So having those testing capabilities while people are isolating to do the right thing for the community are really important, so we can get the workforce going and continue the businesses to continue to try and thrive and recover here in Lake County. Very important. I do also want to say I appreciate, as a business owner in South County, Walmart has been very open to come out. We have, as a Middletown Rancheria and Twin Pine Casino, we've used them multiple times to come out and give flu shots, Walmart vaccination. Here, I don't know what's going on, Sam. Vaccinations.
The mic is pointed away from you. It's got to be directly in your face.
It has to be directly in your face.
Like this?
Yeah. This needs to be directly, as soon as it's just ricocheting.
All right, thank you.
That's what it is.
Thank you very much. And so I just, I know there are a lot of different agencies that are looking to do things. I think there's some new testing sites also that are popping up throughout the county. I don't know all the names, but I do know there's a new one in South County set up out in Hidden Valley that's doing things. So just communication with the local folks and business owners that are doing stuff. So today, I think that Walmart is at our facility doing testing and vaccinations, I think, from 11 to 3. It's open to the public, I think, from 12 to 3. So I just want to make sure that we're continuing to support all the agencies out there, in this process. So that'd be great. I would also request, Chair, that you reach out to Tribal Health. It'd be great during these next 4 to 6 weeks that we have Tribal Health also here, because still there's a non-reporting, there's the state and Tribal Health aren't talking to each other. Those numbers that are being treated by there, it doesn't make any sense. We've had multiple meetings, but people vaccinated and tested in our community are very important. So Chair, I would request, if you need any assistance, I can help you with that too, but having our Tribal Health representative, Ernesto, here to just give updates, I think is very important. As Supervisor, knowing numbers, there are a lot of folks that are testing at home, and we don't get that data, so I think any information we can bring to the table here is greatly needed. So that's really all I have today, and I want to thank everybody that's on the screen up there and everyone working on this issue as we move through these next 6 weeks. Yes, it may be trying, but we know a lot more than we did when this started in 2019, 2020. And I know we're going to attempt to do the best that we can as we move forward, and we're going to be okay. That's all I know. So thank you very much.
Supervisor Pyska?
I have a question about the wastewater facilities and when those testing, or when those tests are going to come back, or have those samples been taken already?
Eileen, do you want to share on that? Eileen's working really hard on this one.
Sure. Yeah, so we're working with CDPH, and they have just put us on the schedule to begin testing our Clear Lake facility. That's our biggest facility with the most populous area. and that will start at the end of this month. And so there will be testing 3 days a week on the sewage, and then we'll be getting data coming in early February.
Okay, so we're looking at 2 weeks from now, probably?
Right around there, yeah,
Okay.
2+ weeks. Yep.
Great, thank you.
You're welcome. And we're looking to expand. We're on their list. We're also on CDC's list to see if they can expand to other wastewater plants in the county.
Great.
Okay. And I will reach out to Ernesto in lieu of the next COVID update to ensure, because I know that there are many citizens in Lake County that go to tribal health, native and non-native, that get testing and vaccinations. So make sure we include that. Supervisor Sabatier.
I appreciate the comment made by Supervisor Simon. I just don't understand how our VA and our tribal health cannot communicate with systems with the state. It just doesn't make any sense to me. I don't understand what's going on. It's been 2 years, and it feels like they just don't want to resolve it. They want to have those numbers being unique and separated, and our communities are not separated. Our communities are one, and we're all intermingling, and so it's crazy.
It is. Seeing no other hands up, I'll go ahead and bring it to public input. Unless Director Portnoy, did you have anything to add to this, sir?
I do not at this time. I'm listening and looking forward to public comment and continuing to gain insight from the professionals here in the room. Thank you for asking.
You're welcome, and sorry for putting you on the spot. I just seen you there. All right, so it looks like we have public input in the chambers, and so if you can come up, you have 3 minutes to state your question and concern. Please state your name for the record.
My name is Joan Moss. I want to know, Dr. Pace, if you are the official public health officer. I see you on the closed session items of the Board of Supervisors. I'd like to congratulate you if you are, but are you the official public health officer? And second, I receive your press releases. I appreciate them. I am a journalist. I want to know, you said that the vaccines are still not 100% effective in avoiding COVID-19 or Omicron. I want to know how effective the vaccines can be. Thank you. And the people who don't have vaccines compared to the people who do have vaccines. Thank you.
Joan, I think he's the interim, so your first question, Dr. Pace, I don't know if you wanted to answer, if you had a answer for that question.
Sure, I can, yeah, I'm the interim public health officer. I left the position, last April, and the department and the county is recruiting, and so in the meantime, I'm helping with some other people to kind of fill the role. So I am the official health officer, but it's very limited what I have to offer right now, and the county's actively recruiting. The answer to your second question, I mean, the vaccine was never 100% effective, but it did a really good job before. With Omicron, it's less so. It seems to be able to protect pretty well against hospitalization and severe illness, but not against getting infected and being contagious. So right now, I showed that data earlier, but there's something like if somebody is in contact with somebody with COVID, your chances of getting infected if you're vaccinated is about a quarter of what it is if you're unvaccinated. So if you're unvaccinated, your chances are 4 times of leaving with an infection than if you were vaccinated. For severe disease and death, it's more like 15 to 1. So the vaccine is really good, but it's not 100% protective.
Thank you, Dr. Pace. I don't see anyone else in the chambers that has a public comment, so we'll move on to the Zoom hands that are up. And I just wanted to start with Jeremy Rarick. If you are one of the call-in numbers, would like to start with you since you were earlier trying to give your input during regular public input.
Hello. Can you hear me?
Yes.
Okay, I wanted to, after hearing what Gary had to say, I kind of wanted to tell a little bit about what recently happened to me at Adventist Hospital here in Lake County. On November 28th, I went in with chest pains, tightness of my chest. I was really having a cardiac event. The nurse there, she started to make jokes about why I wasn't vaccinated. She went on to say that, are you afraid of microchips? Are you this, that? It ended up being a pulmonary embolism, and they let me walk out of there. But the only thing they seemed concerned about was I vaccinated or not? It almost killed me. So I think we have to look at what we say and how our public health policy affects the actual workers in these hospitals. When we demonize the unvaccinated and we say that the unvaccinated, are the dirty, grimy people, and that's how people feel. They're the ones that are going to get everybody sick, the plague rats. Well, just a few months ago, I said the exact same thing that Gary Pace said today. And Simon, our Supervisor Moak, said I was a conspiracy theorist. That I did, everything I was saying was just made up mumbo jumbo. And it was the exact same thing that Gary Pace said today, that you can still transmit and catch COVID whether you're vaccinated or not. Now, wouldn't it be more dangerous if for a vaccinated person who doesn't know they have the disease but can still spread it or transmit it to be walking around? They don't even know that they're sick. Where the unvaccinated people, if they get a little cold or whatever, many scientists have already said that Omicron presents as common cold. It's not a life or death. How many people might have died recently in Lake County out of 60,000 people here? So I just want to look at this for what it is. You just heard Moak a minute ago. He acted like a meteor was going to hit the earth. How will we get through the next 6 weeks? There has to be a stop at some point where we just learn to live with this thing and take care of ourselves. We should worry about taking care of ourselves, eating healthy, losing weight, and boosting our own immune systems. Yep, and it's going to be many more mutations after this one. And every time
it looks like your time is up, so if you could wrap up your comment.
Okay, yeah, I just don't think we should start shutdowns or closing places or doing all this stuff all over again, because it's going to happen over and over and over. Hey, take care.
Thank you for your comment. Next, we have Carlos Bono.
Good morning. Before I begin, I'd like to invite all Lake County residents against medical mandates to sign a petition against medical tyranny at standuplakecounty.org. Now I would like to address the inefficacy and danger of these emergency use
Could you state your name?
inoculations, which has been proven that they do not prevent transmission of infection.
Sir, can you state your name for the record, please?
Oh, I'm sorry. Carlos Bono?
Okay.
Both part of the definition of a vaccine before the pharmaceutical industry conveniently had the definition changed. According to the new definition, any treatment that mitigates the effects of a virus can be considered a vaccine. So hydroxychloroquine and ivermectin could be considered vaccines under the new definition. After over 1 million, hello?
Yes, we hear you. Keep going.
Oh, okay. After over 1 million adverse events and more than 20,000 deaths related to COVID-19 vaccines, quote unquote, according to the CDC, there's no question of the danger these jabs represent, especially to younger people that are at less risk of the virus. According to Nobel laureate Luc Montagnier, who stated in the Wall Street Journal that the jab mandates are, quote, irrational and contrary to the public interest for government to mandate vaccines absent any evidence that the vaccines are effective in stopping the spread of the pathogen. This so-called medical emergency has been ongoing for almost 2 years, and the CDC itself admitted that 75% of all reported CV deaths were in people with at least 4 comorbidities. This means that the CDC and the medical pharmaceutical industry colluded to inflate the numbers of dead in order to push unconstitutional and illegal measures on the population with the purpose of taking away our God-given freedoms. Also, the medical profession and hospitals receive considerable incentives in treating cases and reporting deaths attributed to COVID-19. This constitutes one of the, if not the biggest crimes against humanity since World War II. I have urged and continue to urge the Lake County Board of Supervisors to stop promoting these experimental jabs and get on the right side of history. The number of cases has skyrocketed over the past month, but most cases are mild due to the current Omicron variant, and many of these cases are in fully vaccinated and boosted individuals, 2 of which I know personally. This milder virus could provide herd immunity and negates the need for these dangerous vaccines and boosters. Also, early treatment with several cheap pharmaceutical drugs has proven effective in completely eradicating the virus, as we have seen in the Uttar Pradesh province of India, where the use of ivermectin was seen to completely stop COVID and now has no cases. To continue to promote and mandate vaccinations, masks, and other illegal and unconstitutional measures constitutes a crime against humanity, and the Board of Supervisors has the obligation to stop the crime in the name of their constituents. I'd like to add that these vaccines don't work. They're not really vaccines. They changed the definition of vaccine.
If you can get to the end of your statement, your 3 minutes is up.
Okay. Yeah, I'd just like to, again, I'd like to urge all the residents of Lake County to go to standuplakecounty.org and sign our petition, which we will be presenting before this Board of Supervisors as soon as we hit 1,000 signatures. Thank you.
Thank you. Next, we have phone 4627. If you could please state your name for the record as well, and you have 3 minutes.
Good morning, this is Tom Slade. Can you hear me okay?
Yes, I can hear you. If you could speak further, closer into your microphone, it would help, though.
Okay, let me know if
There we
it's
go.
working.
We're great.
Yep, everyone. I just had a few thoughts, and this is my perspective. It's as if the supervisor meeting is a courtroom, but we get the one official side, and then a few of us have to call in with at least other information. And we've called, a lot of us have called in numerous times. We have early treatments, ivermectin, HCQ, that apparently do work, and a PCR test that apparently doesn't work. So there's a lot of background information, but I would, it has occurred to me and maybe everyone that we don't need to worry about terrorism anymore. Not a problem anymore. We all need to be afraid of a silent killer that's ripping through the county. So what is the actual reality? Well, I don't know, but this absolutely looks like fear-mongering to me. And what I have noticed is, as far as supporting local businesses, I won't mention one, but there's a local business that I used to support, but they demand masks before I even walk in the door. So from now on, that product I will be buying from Amazon. I will not be supporting that business anymore, and they can do what they want. But what I am noticing, so many people are not wearing masks. I'm not a mind reader. I think they no longer believe it. It's not COVID fatigue. People are beginning to realize how many endless surges are going to rip through Lake County again and again and again. And I think our health, Mr. Pace or Dr. Pace said something about lockdowns and others seem to be working. Well, it would seem to me if we have another surge ripping through Lake County, that is highly doubtful. So again, getting back to this, a lot of people are not wearing masks. And I think because they simply don't believe it, because in my opinion, it is no longer believable. Have a nice day.
Thank you, Mr. Slade. I don't think he said that they were doing lockdowns in Sonoma. I think he was saying that they were recommending, it was more of a recommendation to do so. Yeah, to stay home. So next we have phone 6205. If you could state your name for the record, you have 3 minutes.
Good morning. This is Bart Levinson. Can you hear me?
Yes, very clearly.
Thank you very much. I tried to call the health department and spoke with them last Friday to get some updated information. I wanted to know what the schedule would be of availability of our COVID updates for Lake County, and they were not able to tell me. I also asked about something that I heard in Mendocino County, that they had and were distributing 14,000 free tests. And I was told that they were not available in Lake County. So I'm wondering if the information could be updated more timely and more fully with our local health department, please, and to make sure that we have access to the information online so that we as citizens can keep track of the actual situation. Sorry, I just blanked on the other thing that I was going to address was from the previous caller. Sorry, I've lost it.
Oh, no, it's okay.
So that was what I wanted to speak to. Thank you very much.
Thank you, Ms. Levinson. Next, we have phone 1113. If you could state your name for the record, you have 3 minutes.
Yes, hi. This is Dr. Will Tuttle calling. I'd like to address this pandemic response by the Lake County officials, you guys. And again, I really am very concerned about this. Irrefutably, we can see that science is showing that the COVID-19 vaccine is not safe, it's not effective in limiting transmission, it's not effective in limiting infection from this coronavirus. And this is false propaganda, really. The whole narrative is falling apart. It's put out by public officials who are now continuing to push this vaccine, and it's a clear breach of duty. Public office holders are subject to and aware of a duty to prevent death or serious injury that arises by virtue of the function of the public office that you're in. And I think many of you are breaching that duty and recklessly causing a risk of death or serious injury by carrying on, regardless of how the now confirmed dangers associated with the injection for COVID-19. Some of these risks are blood clotting, myocarditis, pericarditis, thrombosis, thrombocytopenia, anaphylaxis, Bell's palsy, Guillain-Barré syndrome, cancer. 20,000 people have died already. These are very extremely concerning numbers in the United States. We've got close to 1 million people who are harmed by these vaccines. This doesn't seem to be discussed. And I think we have to realize that the survival rate for this 99.7%, as we heard earlier from people with multiple already pre-existing conditions. And also we have a case-demic, and the PCR test now we're in January, which was used for almost 2 years to scare everybody into being terrified of this thing. And now we say that COVID test is no good. The CDC says, well, actually it was a bunch of false positives. So now we have other tests, right? How do we know those aren't false positives? And there's something that's very important to understand is that some of these tests, like the IntelliSwab COVID-19 rapid test, which is approved by the FDA, and they have in their information, they say, quote, potential cross-reactivity of this test with COVID-19 vaccines has not been evaluated. So they haven't even evaluated whether getting vaccinated will cause you to get a false positive. So for example, if someone takes the COVID vaccine, so now he can go back to work at his office, but then the boss wants all the employees to keep getting tested. So 3 weeks later, he gets tested, and because the test cross-reacts with the vaccine, he's told that he's positive. So now he has to go home. He might end up in the hospital. He might end up being put on a ventilator, which very often kills people, or being given remdesivir, which I've heard that nurses jokingly say, run, death is near. They call it run, death is near because it kills so many people. So I think, again, this is highly irresponsible to not talk about these side effects. Thank you very much.
Thank you. Next, we have Julia Bono. If you have 3 minutes, please state your name for the record.
Hello, can you hear me?
Yes.
All right, my name is Julia Bono, and I have a background and degrees in scientific research. First of all, in this worrying time of dramatically increasing Omicron variant COVID cases, I wish to correct misinformation previously given to the board today by Dr. Pace and clarify that a September 2021 study by UC Davis researchers showed that the vaccinated who get Delta variant COVID are just as infectious as the unvaccinated who get it. Secondly, with respect to effectiveness, Newsweek reported today that over 1/3 of Americans vaccinated against COVID-19 now say they became infected with the virus after being fully inoculated. That includes a number of personal friends of mine who were vaccinated and reported that they subsequently got affected. Also, an Israeli study published last September showed natural immunity was 13 times better in preventing Delta variant COVID than double Pfizer vaccination. Furthermore, a June 2021 study showed that consuming a healthy plant-based diet was 5 times more effective in preventing moderate to severe COVID than diets heavy in animal products, which shows nutritional prevention measures can be more effective than vaccination. Finally, and they're much safer also. Finally, I want to highlight the many news reports of batches of contaminated COVID-19 injections to address the poor safety record of using experimental COVID vaccines in the general population outside of a properly monitored, fully informed, and properly compensated clinical trial with a control group. First of all, in the United States, California warned against using batches of Moderna COVID-19 vaccines after allergic reactions were seen in January 2021. This was reported in the LA Times. Secondly, the Wall Street Journal reported in April 2021 that poor quality Johnson & Johnson batch ingredients were investigated. Let's see, CNBC reported in June 2021 regarding the Johnson & Johnson vaccines that an FDA inspection of the plant also turned up a long list of sanitary problems and bad manufacturing practices. The New York Times reported in March 2021 that when contract manufacturer Emergent Biosolutions contaminated at least 15 million doses of Johnson & Johnson's COVID-19 vaccination and millions more doses of AstraZeneca's vaccine as this Baltimore facility earlier this year, the company had been collecting monthly payments of $27 million from the U.S. government, payments that were intended to help Emergent avoid such a manufacturing disaster. Federal regulators have told Johnson & Johnson that about 60 million doses of coronavirus vaccine produced at a troubled Baltimore factory cannot be used because of possible contamination. The Food and Drug Administration plans to allow 10 million doses to be distributed in the United States or sent to other countries, but with a warning that regulators cannot guarantee that Emergent Biosolutions, the company that operates the plant, followed good manufacturing practices. In Japan, Moderna vaccine batches have contamination issues with metal fragments. They also found black particles in Moderna vaccine. In Vietnam, several Vietnamese students died after getting the Pfizer COVID-19 vaccine in December 2021. 120 Vietnamese children were reported admitted to hospital after the COVID-19 vaccines, and they suspended use of the Pfizer vaccine batch in December 2021. Please. In the UK, in Italy, there's been a whole series of reports of the AstraZeneca
if you can finish your statement, we would greatly appreciate it.
And various batches having problems. So I wanted to highlight that to wrap up and say that there are definitely safety issues with respect to using experimental medical procedures on a vast portion of our population.
Thank you.
And that
we're going to move on to the next
that is
person.
unconscionable should be considered a crime against humanity.
Zacher, I hope I pronounced your name accurately, Zacher or Zacher. Please correct me by stating your name for the record. You have 3 minutes. Elaine, are you there? So what we'll do is move on to phone 2689 and come back to Elaine if she can get on board after that. Phone 2689, please state your name for the record. You have 3 minutes, and go ahead.
Thank you, Board of Supervisors. Christina Robertson, can you hear me?
Yes.
Yes, delayed treatment has been devastating for some, yet early treatment is suppressed. Scientific debate is suppressed. We're experiencing all kinds of censorship here, while the government now is calling mandates and such. I do want to talk about some injuries. Maddie DeGray, that's Maddie, D-E space G-A-R-A-Y, a 14-year-old who participated in the Pfizer trial and suffered severe neurological injuries, including seizures and permanent paralysis. However, Pfizer reported only that Maddie suffered a stomachache. The Pfizer vaccine only gained emergency authorization for use in children because Pfizer manipulated trial data and committed serious offenses, like hiding Maddie DeGray's injury. I'm reading directly from the book, The Real Anthony Fauci by Robert Kennedy. Now, look, this is an attorney who can lose his career if he writes very thoroughly documented, meticulous documentation in this book. And I challenge anyone to read it. And he actually challenges anyone to prove him wrong. He is an attorney who wins big, big cases. So I want to go ahead and read something else out of this book. According to an article in Current Trends in Cardiology, within 8 weeks of the public offering of COVID-19 products to the 12 to 15-year-old age group, we found 19 times the expected number of myocarditis cases in the vaccination volunteers over background myocarditis rates for this age group. That's pretty alarming. And I do need to go back to Maddie DeGray. Please remember that name. She's in a wheelchair for life. Jacob Klinick, 13-year-old, died. Kyle Warner, 29-year-old, professional biking athlete, life-altering myocarditis. You know, they say within 5 years there's a 50% chance of not being on the planet anymore. We have to look at this, follow the money and ask questions and quit being hypnotized. Hospitals are now still paid $13,000 for a COVID-19 diagnosis, $39,000 for a ventilator. Why are ventilators even in the picture anymore? They should be rarely used. Webster now defines an anti-vaxxer as a person who is opposed to use of vaccines, or, get this, regulations mandating vaccines. You now cannot even oppose regulations mandating vaccines without being called an anti-vaxxer. One of those terms designed to make people dismiss information.
If you can wrap up the
true, real
comments so that we
information.
can move forward.
Yes, vaccinating children is unethical. How can anybody consider it ethical to put a child at risk for the pretext that it might shield an adult? Children are not at risk of harm from COVID-19.
Thank you for that.
I'm hoping I have one more. Do I have one more second to say one more last sentence?
You've had over 3 minutes, and it's not fair to the others that probably want to speak. But I'll let you, because I don't want you to feel like you're being censored. Is she there? No, okay. Elaine Zacher, you are next, if we can hear you first. Oh, she was?
Yes.
Oh, no, there she is. We can hear you.
This is Elaine Zacher. Can you hear me?
Yes.
Hello?
Yes, we can hear you. I can hear you, yes.
Okay. I have a couple questions for Dr. Pace. When someone comes to the emergency room or is admitted to the hospital with symptoms that that person has never had before, is that person asked whether he or she has recently received a COVID shot? If the answer is yes, is this reported to the CDC VAERS system? Thank you.
Dr. Pace, if you have an answer for that.
Well, I can't speak to what's happening in the two local hospitals, but I know as a clinician that when somebody shows up with some symptoms, one of the questions would be, are you vaccinated? And if so, when did you get it? So that would be part of the differential in terms of working through somebody's, trying to figure out the diagnosis. And then if it's a unusual symptom that seems like where you've come to is that it's caused by the vaccine, or that's likely that's associated with the vaccine, then yeah, that's typically would be reported to the VAERS system.
Okay, thank you. It doesn't look like we have any further public comments, so I'll bring it back to the board for any final comments or Dr. Pace, if you had anything else to add or wanted to speak more on anything, then CAO Hutchinson, go ahead.
Yes, Mr. Chair, I just wanted to add a clarifying point to some of the earlier discussion when the supervisors were talking about having conversations in your district with pharmacies about offering more capacity. And one area that I think you could be very helpful to the public health team would be if you contacted the pharmacies in your district and encourage them to add full scope to the vaccine offerings that they're giving so that all persons can be vaccinated there. Some of the sites just offer vaccine to persons 18 and over. So if your board would be willing to take that on, I think that could be a great help.
Thank you. Thank you.
And if you'd like, I can make sure the team provides you with that data for your districts. Eileen, would that be possible? So you know what they offer when you make the contact.
All right.
Absolutely. Thank you.
Thank you.
And Mr. Chair,
yes.
Just a couple thoughts. One is I heard what Supervisor Simon was saying about the businesses, and we do have quite a supply of these boxes of 40 Binax Now antigen tests. And so if some of the businesses are interested in getting some of these in order to test their employees and help keep their workplace safe, I think we can probably provide that to some of the businesses. So if that's of interest to some of the businesses in the community, they should contact us through the COVID warm line, and we'll see what we can do with that. I think the other thing is this is obviously a very stressful time for the community and for people all around the country. And I just appreciate this forum and having people be able to voice different viewpoints and kind of try to get information out there. It's always concerning if some of this controversy ends up keeping people from getting care that may eventually be life-saving. So we just really, I think it's a great opportunity to talk about this and get the information out. So just want to say thank you for letting me talk today.
Of course. Thank you again, Dr. Pace. And CEO Hutchinson, you have your hand up again?
Just to add to that, the warm line that Dr. Pace just referenced, the telephone number a local business can call to request a box of test kits is 707-263-8174.
Thank you for that. And I'll just address a couple of things real briefly. When it comes to censorship, each week we talk about the things in this chamber, and we give 3 minutes for public input. We know it's very difficult at times for people to come up, and we understand in person if you're having a tough time, we'll give you some extra time. And often with the folks that have been overlapping, we give you that extra time. A lot of you are repeat, you bring things forward repetitively, so if that's fine. We need to hear that, and that's what this is here for. So we're not trying to censor anybody. You have your right to say what you need. You can also write in. That might help too, so that you get more. Mr. Slate was one of them who sent in a letter to us and the book that was referenced many times during these statements. So I appreciate that. And so we do listen to who we have to. And being a part of this, you have your 3 minutes. And it's not fair to other people that need to have their 3 minutes to wait while others push forward. I'd like to also address a lot of statements that were made when it comes to fear-mongering and things of that nature. If people don't believe in this, that's fine. They can have their opinion, but there are people on different areas. We have first responders in our county that are by themselves. They don't have a lot of help. What happens when they get sick? Even if, believe it or not, this happens. Some of you folks are doctors. Some of you folks claim to have all of these different backgrounds. Volunteer to help if you're not afraid of it. Let's work together instead of trying to find ways to split us apart. You spend a lot of energy researching, and I appreciate that. You should always do that. But if you can, volunteer and help if you're not afraid of it and you don't want to wear a mask. Come help these folks that need help with this thing, and vice versa. Reach out to the other side with the people that don't believe in it if you are a person that believes in this vaccination. Let's work together to get things moving rather than constantly sitting here bickering while people keep getting sick and we're not addressing the problem. I just had to say that. Supervisor Sabatier, you had your pen up. If you have anything to state, please.
I just, there's a number that gets thrown around, and I don't even know where that number comes from, but this idea of 99.7, it just seems to be like a commonly used number. We have to at least acknowledge a foundation of data, and there is no foundation of data where 99.7 exists. It has been a fluctuating number. When we were in the heat of the moment of COVID, when we had a large amount of cases and a large number of deaths in the earlier in October, November, I think, was when we hit our huge surge. We were almost at 4% death rate. On average, since the very beginning, we're at about 1.5. In the state, it's about 1.6, and in the U.S., it's about 1.5, 1.4. We can't just use random numbers. We can disagree on the actions we take based on the data, but at one point we have to agree what the data is, or else we're not talking to each other. We're not having a dialogue. We're just throwing stuff at each other. Right. And I think that we have to come from time to time. We receive information. The CDC says this. Well, if you can't believe what the numbers are on the CDC, then don't provide another portion of it that you do agree with. We have to at least find a basis of where the data is and what the data is. The data is that 0.1 death rate is the flu, and we're experiencing anywhere at one point up to 4% recently, and on average for the duration of it, 1.5. That is an extreme difference versus 0.1, the flu. And so nobody here on this board has ordered or has spoken of support of mandates. And so I don't know why we're being talked to about the Nuremberg Code. We are seeing data that says that our hospitals, our local hospitals, are seeing a higher level of severity and deaths with those that are unvaccinated, hence why we recommend people getting vaccinated. There's a lot of very harsh language and inconsistent language, and it's easy to cherry pick. I could cherry pick names in our community of people that have died because of the virus too. We need to look at the aggregate data and be able to make the best decisions. Please be respectful of the people around you, no matter how they feel about this pandemic and how they feel about the decisions being made about it. If you walk in someone's house and they ask you to take your shoes off, you take your shoes off. If you happen to walk into a store that is absolutely going to make sure 100% of their customers wear a mask, either you don't walk in or you respect what they're asking you to do. If you see somebody without a mask, let the authority in that area deal with that. Let's not become confrontational because we see things that we disagree with. It's become such a confrontational issue. We have to back up. We're losing sense of community because of this issue, and we're forgetting that. Yes, there's maybe 20,000 people that if it was 100% sure that they died because of the vaccine, there's 900,000 people that died from the virus. And those have been proven. And so we have this very circular motion of rhetoric that we keep hearing, and nothing is coming from this board of half the comments that are being thrown at us. Nobody here has mandated anything. We are trying to protect our community the best that we can so we can get past this. We're trying to inform you the best that we can with the information that we have, informing ourselves as well, and doing the best that we can to do what we need to do based on the current status. Has everything been perfect since day one? I'm going to say no. I think that it's been a learning curve. I think we probably went full bore right at the beginning, and then now we're very, very tired of everything that we've had to deal with over the course of the last 2 years. But there's just some comments that keep coming back. 99.7 is one of those that rings in my head. Where does that even come from? I have no idea. And also, just a quick comment, if Jeremy Rarick is still there, please email me with where you found that from the CDC. because I just looked it up and I could not find it. Granted, that doesn't mean that it's not there, but send it to me, please. I'm interested in reading about it, so please.
Thank you. With that, we'll go ahead and close that item on the agenda. Thank you, everybody, for the presentations. Thank you, everyone, for the comments that gave in the public input, and thank you, staff and fellow supervisors, for your input as well. We'll go ahead and entertain a short break, a 5-minute break, before we move on to our 6.4, if that's okay. I know we're behind a little bit, but I think we could use a break. So we'll be back at 10:50.
Just a little bit behind.
All right, welcome back. So our next item is a 6.4, 9:45 a.m. We're sitting as the Board of Directors of Lake County Watershed Protection District, Watershed Protection District, acting as the Big Valley Groundwater Sustainability Agency. We will A, hold a public hearing to receive stakeholder comments on the final draft of the Big Valley Basin Groundwater Sustainability Plan and technical appendices, and B, consider adoption of a resolution adopting the Big Valley Groundwater Sustainability Plan and to authorize the Director of the Lake County Water Resources Department or designated appointee to submit the adopted documents to the California Department of Water Resources in compliance with the Sustainable Groundwater Management Act. When we have Water Resources Deputy Director Marina Delagiani is here with us, and we'll give the floor to you.
Yes, I'm going to go ahead and kick it off to Director Scott DeLeon for a quick introduction.
Sorry about that, Scott. I didn't. I was looking in the room.
That's
Go ahead,
okay.
Director DeLeon.
That's all right. I appreciate that. Good morning, Board. I'm Scott DeLeon, Public Works and Water Resources Director. I am very pleased to be here this morning to introduce this item, which is a public hearing for your board to consider the final draft of the Big Valley Groundwater Sustainability Plan. Today's action is the culmination of months of work that is nothing short of remarkable. And with that, I'd like to again introduce Marina Delagianis, the Deputy Director of Water Resources, who will present this item and likely introduce our consultants who are also with us today to help make this presentation. So with that, thank you very much, Board.
Thank you, Director Scott DeLeon, and thank you, Board of Directors, acting as the Big Valley Groundwater Sustainability Agency / GSA. I am super excited to be here. I know I'm usually pretty excited when it comes to groundwater and our compliance with California Sustainable Groundwater Management Act, but I am extremely excited today as this is a huge milestone for our community. As Director Scott DeLeon said, this has been a very long process, and I am very, very proud of our team, our Groundwater Sustainability Agency Advisory Committee, and our stakeholders who have helped really put us here where we're at today. So with that being said, Marina Delagianis, Deputy Water Resources Director. I also serve as the lead for the Groundwater Sustainability Plan Advisory Committee. I am joined here with some of our team members, and I am joined here with William. Go ahead.
Hello, my name is William Fox, and I'm a Water Resources Program Coordinator for the Lake County Water Resources Department, and served as technical and field support for the Big Valley Groundwater Sustainability Plan. Thank you. And I'll pass it over to Eddie Teasdale, our consultant for the Big Valley Groundwater Sustainability Plan.
Great, thank you, William. Yeah, this is Eddie Teasdale with Ludor from Scalmanini Consulting Engineers. I'm a hydrogeologist, and I've been the project manager on this task. And I think with that, I'll turn it over to Christy, Stantec.
I am Christy Clark, and I am with Stantec Consulting, and I have been working for about the last 2 years with Marina and William as both the lead facilitator for communication and then also with the tech team. So Ibrahim, I'll go ahead and pass it to you.
Good morning, Ibrahim Kadam with Stantec. I've been the technical lead on preparing the GSP, working closely with Eddie and Christy and the team.
Megan?
Hi everyone, my name is Megan Murray. I am a water resources planner with Stantec, and I have served as the documentation lead for the Groundwater Sustainability Plan. And I will begin sharing my screen here for Marina to run through the presentation.
Perfect. Thank you, everyone. And as Megan mentioned, I have a very brief presentation just to set the stage. I know we've all heard this before, but we can never talk enough about groundwater. So if you go ahead, Megan, don't mind going to slide number 2, please. All right, so why are we here? Again, we are successfully complying with California Sustainable Groundwater Management Act. So of course, in 2014, California passed the California Sustainable Groundwater Management Act, also referred to as SGMA, and this basically sets the stage for us here at the local level to make sure that we are sustainably managing our groundwater basin. So out of all the groundwater basins that we have in the county, we are working with only one basin, and that is our Big Valley Groundwater Basin. Very ag heavy. It is in the southern portion of the county. Right below Clear Lake. And I also want to highlight some of the support that we've received from California State Water Resource Department and the State Water Resources Control Board. So SGMA also provides us the framework, again, to ensure that we are managing our groundwater basin sustainably, but also locally. So they rely heavily on us here at the local level, including stakeholders, the Watershed Protection District, et cetera, because we live in our basin, we know our basin, right? But they have also helped us tremendously. Some of the resources that we've been able to be provided by the state include funds, which, while we're here today, we were awarded a little under $1.4 million under California Sustainable Groundwater Management Program to develop and implement our GSP. So many kudos to them, and that's how we were able to onboard our awesome team of consultants to help us develop this GSP to the best of our ability. We were also awarded facilitation support services, again, to help us develop a communication and engagement outreach plan that is not only required by SGMA, but to make sure that we are bringing all the proper people to the table and that we are continuing on these conversations. We have also awarded technical support services through California Department of Water Resources. Many kudos to William Fox, who was able to submit the application to help us increase the understanding of the conditions of our groundwater basin. You all have been familiar and may have seen the huge helicopter that was flying over our groundwater basin. That was the airborne electromagnetic surveys, again, just to give us a better idea of the conditions of our groundwater basins. We should be receiving those results in the next year or two. And then also just a letter of support from the State Water Resource Control Board, commending us on our efforts. We were a little bit behind the game before we started, but now we're up to speed. So huge shout out to the state for all their support and guidance and expertise during this development process. Next slide, please, Megan. Thank you. All right, so what is a groundwater sustainability plan, also referred to as a GSP? The state not only tells us, hey, you guys should do this, but also how do we do this? So you can check out all of our GSP documents on the Water Resources website. We have all of the chapters here. I hope you can see this. If not, go to Water Resources website. We have it available, or you can come visit us on the 3rd floor and we can help you gain access to this document. So many pages, but basically what this document tells us is what are the conditions of our groundwater basin and how we are going to sustainably manage our groundwater basin. Next slide, please. So during the entire process of our groundwater sustainability plan, it has been public facing. Again, we were not able to do this without the dedicated community members who have been involved with us since the past year or so, who have actively come to all of our meetings. We've had multiple meetings, 36 plus meetings to be exact, that have all been available to the public. As we can imagine, the COVID pandemic has been very difficult for us to meet, but we were able to have some hybrid meetings where, of course, social distancing protocols were in place, and we had access to Zoom as well, and we did have translation services available. So this was just one of many ways that we were able to get the community involved. So between public, Big Valley, groundwater public meeting open houses, so folks were able to come talk to our consultants. If there was a chapter or an aspect of the GSP that they were not familiar with or did not comprehend, they could come talk to us and we can walk them through it. We also have our monthly Big Valley Groundwater Sustainability Plan Advisory Committee. I would like to give a huge kudos and shout out to this dedicated roughly 10 members of the public. You can see we have members sitting on the Groundwater Sustainability Plan Advisory Committee from Water Resources, Special Districts, Big Valley Rancheria, Lake County Farm Bureau, Lake County Land Trust, Kelseyville Unified School District, and the Tri-Council, among with also private well owners, domestic well owners, and then again, members of the public were able to come here. So with this, our consultants were able to have these one-on-one discussions, including sub-technical committee meetings where we were able to do a deeper dive into whether it be the hydrologic model, groundwater dependent ecosystems, sustainable management criteria, et cetera, where we were able to get all this info and knowledge sharing. And our consultants also were able to come visit us here in Lake County a few times for some field days where not only we were able to talk about what we were developing, but they could also see what we were talking about, whether it be the Kelsey Creek detention structure or hitch, et cetera. They were able to get boots on the ground and see what we were talking about and how we were going to incorporate all this information into our groundwater sustainability plan. Next slide, please. All right, so among the opportunities, so every chapter that came out, every part of this document that was completed, not only did our GSPAC, which again is our Groundwater Sustainability Plan Advisory Committee, have the opportunity to review these chapters. Again, huge kudos to them because this is a very hefty document, if folks can see right here. They took the time and effort and energy to read all of these pages, provide input and comments to our consultants to make sure that we were doing everything properly. So not only did our advisory committee have the opportunity to read this document, the public did too. So we did hold a formal 21-day public comment period where we were able to collect all these public comments and then put them in a matrix, which you can see in section 7, appendix 7C, which outlined every comment that was submitted and not only what comment was submitted, but how we addressed it. So besides the public comment period that we had, we also, again, we took every comment that was submitted, whether it be during an advisory committee meeting, a public meeting, via email. Those were all addressed. Thank you to the hard work of our team, including our consultants. So I would just like to go over very briefly from the public comment period that took place for our draft groundwater sustainability plan. There were 5 main themes that were commented on, and again, you can find that in section 7C in our GSP, and those main themes were the updating of the basin characterization, the groundwater dependent ecosystem identification, also referred to as GDEs, our monitoring network, our sustainable management criteria, projects and management actions. So not only was it outlined when those came up, how many folks commented on them, but how they were addressed in our GSP. Next slide, please. All right, so we're not done yet. I want to just reiterate that our GSP is not the end of this process. In fact, this is the starting point of ensuring that we reach and maintain sustainability for our Big Valley groundwater basin. So folks may think, oh, this is the last opportunity that we have to be involved in these discussions. Have no fear, it is not. We are going to continue the momentum, and in fact, the momentum is going to continue on forward. So this is a crucial aspect of making sure that we meet this deadline of January 31st, 2022, to make sure that we can maintain local control of our groundwater basin. So a few other opportunities that we will have to revisit this GSP and make sure that we are able to meet what is in this GSP, look at the data that is coming through, as I outlined in the previous slides. We are collecting a lot of data as we go on. We have a solid understanding of the conditions of our groundwater basin, but we all know that things are changing, and that's the whole reason why SGMA was put into place. So we will have an annual report that is due in April, again revisiting what we outlined, any updated information that we have. We also have a 5-year plan, and etc. So this is the starting point. All the flags are going, and we're going to continue to take off to make sure that we comply with SGMA and make sure that we maintain sustainability in our basin. And the last slide, please, Megan. Awesome. So I like to always end the slide with our contact information. All of this material, all of the archived information is on the Water Resources website. We also have a YouTube, so if you want to go back and you're bored one day, you can watch all of our previous meetings. You can find the meeting agendas and the meeting summaries as well. So with that being said, I'm going to go ahead. Megan, if you could stop sharing your screen, please, and I'm going to welcome our team up to field any questions that our Groundwater Sustainability Agency may have, and then the public. Thank you.
Thank you. Anyone from the team, if you have anything to add to Director Delagiani or Deputy Director Delagiani's statement, please go ahead and speak, if you will. Okay. Doesn't look like we have anything to add. Mr. Fox, do you have anything to add, or?
No, just the fact that I've really appreciated all the support from our consulting team, the public, the GSPAC, the GSA as well. I feel very lucky to serve here and to work here, and so with that, I'd like to break it open for public comment.
Okay. Any questions? Supervisor Sabatier.
I will say there's one thing that stood out to me, and maybe I've had a misunderstanding this entire time. I've thought groundwater, something below the ground, and there's a huge section, and it speaks oftentimes about the hitch, and I was just flipping through, like, is there a project? Like, is there an idea? It all makes sense in the sense that groundwater comes from where? It doesn't just automatically get forced underground. It has to come from rain, from lakes, from just bodies of water. But since this is called groundwater, I'm kind of curious, is it just because if the groundwater does well and our water table is sustainable, then I would suspect that that means that whatever the current status is of our streams and our creeks with the hitch would also continue as is, which is not necessarily great in comparison to the past, but it would continue as is. A healthy groundwater would possibly mean a healthy stream and other bodies of water. But is there something more specific as to what is anticipated to be done here with this Sigma program when it comes to the hitch?
Yeah, so great question, and you hit the nail on the head right there with that. So we do have representatives from the Tri-Council, and we also do acknowledge that the hitch, we have, creeks, some of their main spawning tributaries in our Big Valley Basin. So what Sigma outlines is they make us think of all uses and users, right? And the hitch, which is a species, they can't speak for themselves. They are involved in this, that'd be really cool, but they are involved in this process, and we have to consider that, right? So that's exactly what we look for. And, hitch surveys are a thing, so we look at that, and we look at the conditions to make sure that our groundwater is safe for not only ag and available for ag users, but the hitch as well, our groundwater dependent ecosystems. And there's a chapter specifically in our GSP that outlines that. And I'm going to pass it over if anyone on our consulting team wants to elaborate a little bit more on the hitch.
This is Ibrahim. A really good question, and one of the key projects we've included here to advocate for implementation as we seek potential funding from the state of California is a win-win project for groundwater as well as also for hitch, which is the groundwater conjunctive use or groundwater recharge projects on Adobe Creek. Basically trying to see if we can capture additional water supplies and release them down the creek when the creek is dry to help with the augmenting groundwater recharge, as well as also help with the hitch spawning. So that could be a win-win for both parties.
I appreciate that. That's what I was looking for, was a response of what does the project look like, and having that summary, that's perfect. And it does mix in with the groundwater as well. So I was just curious, that's the one thing that really stood out. Very hard work, obviously, has been put into this. I just want to share my appreciation for the team.
Yes, thank you for that presentation and reading through the information as well. I was glad that in the presentation you explained that it's not over yet and we still have some time, in regards to some of the different public comments, like when it comes to disadvantaged communities. And the reason I bring that up is because I know I'm being on different committees that we obtain or are on. At times, if we're not at the table, then of course, naturally, the people that are designated due to their actual designations, whatever it may be, are going to advocate from their perspective, and so that voice isn't heard. And so, I take it upon myself as well, and I'm pretty sure other supervisors do, to try to find someone to fill that spot, to actually have that voice. And so there's no blame or there's no anything. I just would like to see that in moving forward, and if there's something I can do to help with that, I'd gladly as well. But I don't want to belabor any of this. I think we need to move forward and get this done, and appreciate everything you've done with that. And with that, I think we can move to public comment, unless you have something else to add to that.
Nope, I appreciate that. Thank you so much.
Is there anybody in the chambers that would like to come up for public comment? And it looks like we do. If you can come up to the microphone and you state your name, and you have 3 minutes. And let's try to keep it on task with this agenda item, if at all possible.
Joan Moss. I am the recent addition to the advisory committee. I was the one member of the public attending one meeting, and there had been one member of the public attending the evening meeting. And I am trying to do my job. I'm trying not to be critical, but I'm trying to do my job. Okay? A journalist looks at both sides. I found research from the past that lists the Department of Water Resources as the owner and operator of the Bottle Rock power plant. And I found a sustainable management plan for that groundwater that does mention geothermal water. And on the wall, there was a woman that said, I remember, Joan, we did have geothermal water entering the groundwater. And I have articles that might never have been published. I found one that was only in longhand, but I believe that the State Department of, this is a big time for me. The State Department of Water Resources owned the Bottle Rock plant where accidents took place and toxics were found. So I think there's a conflict of interest with the State Department of Water Resources and the Sustainable Groundwater Plan being in charge of this plan when the Bottle Rock power plant way up there, the waters went down, and during a period of drought, there was problems. People flushed bath toilets and there was warm water. I want to apologize for Eddie Teasdale. He said the groundwater quality is good. What he said is the groundwater quality testing is good. So I want to publicly apologize for him. I read some of this over and over and over. And initially, Marina was really happy because I joined, because they do need one member of the public. Well, they got one heck of a member. So I'm handing in this material. I want to be honest. I'm talking to a lawyer, and I believe that there is a conflict of interest here. And I want to say that. And I also want to say that Ms. Scully had a really good idea about Highland Springs Reservoir and the hitch. And she was a meeting before I was, but she did say it, I read it in the comments, and both Peter Windrum and Sarah Ryan are concerned because the hitch haven't spawned in the last 2 summers because of the drought. And Mrs. Scully had an answer. And I'm glad to know that this is not the final, because I thought that there was going to be another public comment period.
If you can wrap up.
Next spring where I could talk. But I'm handing in these documents.
Thank you.
I can get copies. I don't know. It's not to you.
Yeah,
I don't know if it's to Marina. I hope
Yes,
you'll
you
share them.
can give it to Marina. Thank you.
Because
And-
it is public record documents
Excellent.
from Joan Moss, member of the public,
Thank
of
you.
the advisory committee.
Thank you for your
I
service
haven't
on
yet
that
handed
committee.
these in.
Okay. We appreciate your comments and your service. Thank you. Did you want to add something? Yes, thank you.
Is this on? Okay.
Yes.
Awesome. So just a few clarifications there. So it is not the California Department of Water Resources developing this plan. It is us here at the local level. So our advisory committee, again, helped develop this plan, and we do have 10 sitting members on there that the board did vote in for that, which is on our Groundwater Sustainability Agency charter document. Again, can be found with us on the 3rd floor or on Water Resources. And we do have, so there should be no conflict of interest. Again, that's the whole objective of this GSP, is to ensure that we at the local level are developing our groundwater sustainability plan and, again, managing it in a sustainable manner at the local level. And I'm going to pass it over to Eddie Teasdale if you have any additions that you would like to add in terms of geothermal.
Yeah, I know, Joan, thanks for the comment. You know, we've talked about this in the past. And again, you know, through the Sigma lens, we are required to monitor for water quality. And we've done that, and we're going to continue to do that. So if something does come up, or as we go through, you know, filling data gaps and we find additional information, I mean, obviously that's going to be incorporated into the annual reports and the 5-year update. So we're not ignoring it, but we're keeping track of water quality as per required by Sigma. That's all I have to say. Thanks.
Thank you. All right. Any other questions or, I don't see anybody on Zoom that has their hand up. Let's see. No, oh, actually I do. There we go. Sarah Ryan, if you can unmute and state your name for the record, and you have 3 minutes.
Thank you. Sarah Ryan, Environmental Director for the Big Valley Band of Pomo Indians. We submitted a letter, so we did participate, or I specifically participated in the Groundwater Sustainability Plan Advisory Committee. And I hope if I go over 3 minutes a little bit, I'd be allowed to, just because I'm on the committee, went through, you know, all of the programmatic development of this groundwater sustainability plan. So first I'd like to read the letter that we submitted to Marina and Stantec, the consultants, about the plan. And then I just have a few other comments besides that, because I think it's important to put it into public record, and also just so that we could potentially comment on it in this, or you could respond to it.
Yes, please, go ahead.
I have Dear Marina, as a representative for the Big Valley Band of Pomo Indians on the Big Valley Groundwater Sustainability Plan Advisory Committee, I have participated throughout the development of the Big Valley Groundwater Sustainability Plan. The tribe has also used their contractual resources to assist with review of each portion of the plan, and our consultants have brought their considerable skill and knowledge to bear on their review of the plan. There are several insurmountable problems with the Groundwater Sustainability Plan in its draft final form that will be submitted to the California Department of Water Resources in compliance with the Sustainable Groundwater Management Act. The problems have led to my rejection of this plan as it stands. First, the makeup of the advisory committee was not representative of the groundwater users in the Big Valley Basin. Because the majority of the committee members were farmers, this did not allow for a diverse set of views to be robustly discussed. In addition, one seat was not filled, a disadvantaged community seat, and this person could have provided a perspective of the impacts of groundwater management from their unique perspective. The agricultural skew and the decision to go with the majority voting led to several circumstances where an opposing view did not lead to any compromises being developed that would be beneficial to other stakeholders. Second, the time frame was unreasonably short to discuss and fully evaluate the materials. This resulted from Lake County's decision to submit an alt GSP, which was not accepted by DWR. For example, the important hydrologic model used data that we were not able to get copies of and came to conclusions that many on the committee questioned. This made our review incomplete and based on some information that could not be corroborated. Third, the hydrologic model developed by the consultants also identified undesirable results which are supposed to be avoided with the Sustainable Groundwater Management Act, specifically the depletion of surface water due to groundwater pumping. Because of recent comments from California Department of Fish and Wildlife biologists, we have become aware of the drastic situation of the Clear Lake hitch and the fact that there have been several years of no young sighted. We are extremely concerned that the GSP groundwater management of the Big Valley Basin will not prevent the loss of this state-listed species. This plan is supposed to prevent such undesirable results. Fourth, the projects associated with the plan were finalized prior to the model being fully released to the group. If we had known the model identified these undesirable results with surface water depletion, we would have prioritized some projects differently. Fifth, the decisions of minimum thresholds created situations where a percentage of the wells in the Big Valley Basin will go dry. I don't believe that our community understands what they might have to experience, and I don't believe that the advisory committee has the right to make decisions that will allow individuals' wells to go dry. Because of these and other issues, I had to vote to reject this plan. So that's the letter that we submitted. I have a couple other comments about the responses to our comments that we've submitted to the county and to the consultants, and they've responded. And so that's Appendix 7B or 7, I believe. The first is in Appendix 7B. They state organizations represented in the Big Valley GSA interested parties database. I just want to point out that this looks a lot better than it is. That even though it lists, for example, Scotts Valley Band of Pomo Indians and the Nature Conservancy and Clean Water Action, that these are actually not, they were not, seats on here. They were not members. They were allowed to comment as everybody was during the public comment period. But it was not like any of these groups were able to be, robustly representing themselves in the dialogue and discussions of the development of this plan. So that's the first thing. The second is that we have been made aware from the fish and wildlife biologist, and I hate to quote somebody's email, but Ben Ewing from California Department of Fish and Wildlife said, I truly believe if we don't do anything, it is possible the hitch will go extinct in the next 5 years. I'm saying this because of what I've seen in my surveys. So he does electroshocking surveys, on the lake for the last several years. And what Fred, and that's U.S. Fish and Wildlife, what Fred shared with us yesterday. So, these comments from the Fish and Wildlife biologist who identifies that, we have had a distinct loss of hitch that we've seen, really prioritizes for us at Big Valley that we have to be, using the best, not only the best possible data, but also to take into account that if we don't have accurate information and even take the precautionary principle, that we could be losing the Clear Lake hitch. Now, the responses from the consultants on our comments about the 90% loss of flow and the domestic well reduction, or domestic wells that are going to go dry, we don't agree with their comments. We've seen in their model, we've looked at it in terms of climate change, and we don't agree with their response to our comments. So this is a conversation we obviously have to continue. I know that the county is under the gun in getting this plan in. It's the last possible minute. I'm sure you're probably going to approve it today just to make sure the state doesn't get on your back. But I don't think that that's the right way to go about things. That we should have taken the time to not only think about putting meters on the wells of agriculture, because that is something that cannabis is required to do, but also to use data that is not just hearsay, which is what we're getting from the agricultural community about their use for FOSS protection and other things. Agriculture in Lake County has been able to, they're doing wonderful things in certain respects, but in terms of the use of our resources, they're, for the most part, privatizing their profits and socializing the environmental burden and the environmental costs. We've had wells go dry. People are afraid to report their wells because they think they're going to get red tagged or something like that. And it's actually a worse situation than what's being presented in this plan, and also ultimately with this plan. So thank you for allowing me to have a little bit more time to make these comments. I know the county put a lot of effort into this, and we really enjoyed being part of this process, but I don't think that this plan is actually going to meet the requirements of SGMA, and we will be making those comments to the State Department of Water Resources as well. Thank you.
Thank you, Sarah. And just to note, the reason why I allowed the extra time is also because of the reference to my comment was because I read that letter. I'm not sure if everyone else got a chance to, but I'm pretty sure we have. And appreciate your comments. And Marina, if you had something to add to that.
Yeah, and thank you so much, Sarah, for your comments. Definitely duly noted, and I do agree the conversation needs to continue. And I'm certain that everyone that's been involved with this process can agree with that. This was a quick timeline. I can almost be certain when I say that this is record time, that a GSA, a county has developed a groundwater sustainability plan in such quick time. And as stated in a previous item, it wasn't a perfect process. We acknowledge that, but we have the opportunity, and it is, I can say that I promise upon myself as a representative as lead for the Groundwater Sustainability Plan Advisory Committee, that these comments are noted, and that is what our objective is to work for in terms of our annual report, which is right around the corner, our 5-year plan as well, and these comments they're addressed, and I don't want folks to think that they are just going to be passed over. That's the whole purpose for these public comment periods and for the going back to this document and making sure that we reach and maintain sustainability. And as Sarah noted, the hitch, they're a priority for us, protecting the hitch. They are, a protected species. There's a lot of cultural importance to them, and that is a priority for us, is making sure that we protect the basin for not only all the other users, even though it is very ag heavy, but for every uses and users, including, again, those that cannot speak for themselves, including the hitch, including the ecosystem that lays into there. And as Sarah noted, there is another formal public comment period, which is a 75-day public comment period as required by the state. So if this is adopted, there's opportunity for comment in the future. And again, all these comments are sent to us. And I wish we could go back in time. I wish we could have done things differently, but this is our opportunity to make sure that we reach and maintain sustainability for our basin in the local level. And my fear is if we don't, adopt this GSP, that we will lose the microphone or even a voice in that aspect. So, Sarah, again, I truly appreciate your comments, and you have been a huge benefit, you and your team, in developing this. So I appreciate your expertise, and I want to continue with this dialogue. So with that being said, I would like to open it up to our consultants if they have anything else that they would like to add to Sarah's comments.
Yeah, this is Eddie Teasdale. Just a quick analogy, for folks on the call, if you imagine, the Big Valley Subbasin was represented by about a gallon of water. Right now, on an average year, they're using about half a gallon of water. So there's a lot of water in the system. And so we feel like, based on some of the data that we've got access to, a lot of public data, water levels, water quality, we're not seeing big changes. Now going back to sort of the surface water, groundwater interaction and specifically how that impacts the hitch, that's a big unknown. And so again, thankfully, because of the Sigma process, we're looking at ways to fill those data gaps, and we're actually going to develop a more robust monitoring network within that sort of groundwater, surface water interaction to really understand that data, that dynamic. And again, it's a transparent process. It's going to be real data we're going to collect. And then also, I think, as Ibrahim had mentioned previously, we are looking at active projects where we feel like the groundwater basin as a whole is balanced, but there's opportunities to take water from places where we know we have a surplus and get those into the right spots, i.e. the creeks, to help sort of offset some of these issues that we're seeing from the fish, that being experienced by the hitch. So that's just a sort of a shout out to kind of what we're trying to do, recognizing we don't have all the best data, but we're looking to kind of move the process forward. We're kind of been forced to do this. And so I think with that, I'll just open it up for comments, or if others from the team want to talk, that's great.
Yeah. So just wanted to add to a couple points. One, regarding the protection of wells. I mean, it's pretty important we get an assessment, a good handle on domestic well users, and that's kind of one of the key projects we'll be proposing to work on with the Department of Water Resources, to do a survey, because the data set we have on domestic wells is pretty old. It's public data coming from DWR, and we need to update and figure out which wells are active right now, how these wells has been managed, how deep they are. We have the data, as I mentioned, is based on when the drillers put these wells, so back 40, 50 years ago. And so some of it pretty out of date. So we need to really get a handle on that to help us look at that. As protection, understanding this data gap as protection for well owners, domestic well owners, we have put in an adaptive management action plan that will be overseen by the county and also by the advisory committee as we go down in the implementation. And those adaptive management will be kicking every year. There would be a drought or would be any reporting of impact to wells. And then the county, we have a specific set of actions for how to collect information, provide assistance, and reach out to domestic well owners, kind of connect them with available resources, and maybe even take actions in different areas with the groundwater users to help manage the specifics. That's these adaptive management action I'm talking about is above and beyond any MT. So even before we reach any minimum thresholds or impacts, those adaptive management action will be taken care of, will be happening. So that's one. To the hitch question, just building on what Eddie mentioned, I mean, the hitch is in a really dire situation. And we really need collective action to kind of save the hitch. And I know the Chi Council and the tribe and many others that kind of are really cares about that. From the groundwater perspective, what we're looking at is we look back at like 30 years back, at least 30 years, and some areas back to the 1950s and 60s and 70s. We look at the groundwater use in the basin. We don't see significant change in the groundwater use in the basin. I mean, there is some increases, some areas, but overall, the groundwater basin has remained fairly within a specific range. And when we model the interaction between the surface water and the groundwater, everything kind of remained fairly steady over the last 30 years. Over the same time, we see the decline of the hitch. So we're not saying that there is no impact from the groundwater use to the hitch, but what we're saying is there is other factors. And for example, this extreme drought that's happening, climate change, creeks are drying up. And so the action to save the hitch is actually would be through the implementation of this conjunctive use project that we kind of talk about to help augment flows in the creek. Because if the creeks are dry earlier in the year, because of the precipitation pattern, there's nothing else you could do on the groundwater side to help save the hitch unless you put water on the creek. And that's kind of what's the ultimate solution that we think that's needed. Again, I'm really, really thankful to all of the input from Sarah and especially her consultant team. They provided a lot of data for us and they engaged with us constructively and helped us improve the plan, and they were really good partners for us throughout the process.
Thank you. Supervisor Sabatier, looks like you have something to say.
I just kind of want to respond to the comment that we received. I appreciate the concerns, but I mean, even the document speaks of the lack of a certain amount of information to be able to completely analyze. And part of the process within, 2042, 2032, for the ongoing years that this will be implemented is to fix and rectify some of these issues. Is there an impact from agriculture? Yes. And I think just kind of like in a neighborhood, you have people with a clean home and a clean yard, and you have people with a not so clean yard. That doesn't mean we should bulk them all together. And I think the comment was very bulked together. We have farmers who want longevity because that is their lifestyle, that is their livelihood. And others that maybe they're not that smart in thinking in the future and just trying to get away with what's there and trying to get rich in 1 year and walk away because they have no more land to use. And that's not good, but I don't think it's agriculture as a whole. I think we all have to figure out how to work together. I think there's so many other factors involved. It's been mentioned already multiple times, global warming. Groundwater has better protection to it because of the evaporation that's probably occurring more so in the creeks than they are in the groundwater. I think that we have rules and regulations that were set in place that makes this impossible to be perfect in the analysis of what's happening. And this is part of the change that California is asking us to make by recognizing that this is a medium, whatever the specific
Priority basin.
I wanted to say threat, but that wasn't the right term. Can you say that again?
Medium priority basin.
Medium priority basin, because they want us to enhance the ability to keep track. I mean, this talks about enhanced well monitoring all over on the projects, and talks about hitch projects as well. And so I think all of those things that were mentioned in the public comment are there. And I think in the long run, and it talks about installing our own wells that we can go ahead and keep track of, which we have to think of this in a more cumulative way, because it's not one, and I know that the comment that was made that that person recognizes that, but we can monitor this without making an effort that everybody has to submit a well report for what their use is. We can keep track and using Sigma to be able to respond to what's happening to ensure that there is going to be long-term potential for continuing to use the land for whatever's there. Residents are there, recreational, farming, and things like that. And so I think that we're asking for the impossible. If we're going to say let's pause and make sure that we have all accurate information, I think that I don't think, I'm going to assume that you've done everything you can to obtain all the data that you require, but data is also going to be coming to us based on the changes that are being projected to be made because of this document. So that's where I stand. So it's not just a simple approval because it's in front of us. There's a task at hand to make sure that we're paying attention to these things and doing better at how we pay attention and how we react to it.
And I'd just like to follow up with the fact that the state knows that none of these plans submitted from any of the basins around California are going to be perfect. And part of that is addressing those data gaps. And to your point, we are currently submitting grants and have already submitted grants to put in monitoring wells close to streams to better monitor that groundwater stream flow interaction to ensure the sustainability for multi-use benefits, and then also implementing those into the future. And so if we're not the ones maintaining this basin, we're not going to be able to apply for these funds to then actually implement these programs and projects to protect the benefits that we deem here as locals as the most important. So thank you.
I see we have a hand up, and I didn't close public comment, so Betsy, if you can unmute, you have 3 minutes, and following Betsy, I will close public comment.
Thank you, Mr. Chair. I have 2 questions. Is there a relationship between the process for the groundwater sustainability management function and the issuance of new permits by the Community Development Department for projects that will add extraction of groundwater supplies? In other words, is it measured against the available supply to make sure it's not going to impair that? And because many agricultural operations do not require major use permits, will that be changed so that any new use would be included to complete the understanding of what will be impacted for new extraction projects? Thank you.
Thank you, Betsy, for that comment. So perfect segue. So Sigma has not only helped us in terms of our groundwater basin, but also opened up a lot of dialogue between us here at the county level. So, you know, we have to work, and we will continue to work very collaboratively with environmental health in terms of well permitting, getting a better understanding of that process, because it goes hand in hand. Same with the Community Development Department. So as you will note in the Community Development Department did submit a public comment for our GSP. So again, having these conversations, our groundwater basin has to comply with the rules and regulations of Sigma. So that is something I can't promise the specifics down the road, because that's what we'll figure out. But we have to figure out as it relates to Sigma. So these are conversations that have been happening and will continue to happen. And that's something that we are considering and we will continue to consider.
Thank you. Just a quick question for clarity. After reading through everything, I know that you had meetings since April. Was it April or yes?
Yes.
Were there people that came to talk about wells drying up and things of that nature frequently, or was there droves of people coming? I mean, we've had droves of people coming about our cannabis projects in all sorts of areas. I thought maybe they'd come to this, but it looks like they have 75 days to comment, right? Okay.
Yeah, so in terms of our so all of our groundwater sustainability plan advisory committee meetings and our open house, we did have drought updates as it relates to our Big Valley Basin, but we also at the recommendation from our, some of our GSPAC members recommended that we open that conversation greater. So we did look at the tools that are provided by the California Department of Water Resources, specifically their dry well reporting. So we provided any updates in terms of here are the wells that were reported, but we also did acknowledge that we don't have all of that information. So that's another dialogue that we've continued. To answer your question, Supervisor Crandall, we didn't have a whole bunch of people coming in to report these dry wells, but thanks to the committee members that we had, they have been informed, and any of that information, we are starting to create a greater database of that collected. So again, getting any sort of inputs. I know that I've been reached out to by some of your supervisors who have been notifying us, our department, of wells that are going dry, and then same with environmental health too. So just to open up that dialogue, that is something that we've been informed of. We will continue to address, but just shameless plug, if you are notified of any wells that are going dry, you're more than welcome to give us a call at Water Resources at 707-263-2344 so we can continue to collect that data. So
thank you.
You can also report it on My Dry Well, which goes to the state, and it's actually really important to be reporting to the state because then it'll drive funding for us to actually be able to do anything about wells going dry. And to further that point, wells do have a lifespan. They're not going to last forever. So it's important to determine whether a well is running dry because of lowering groundwater well levels or actual poor maintenance of the well, or just it failing because it's a very, very old well. So thank you.
Yeah, I appreciate that. I just think about it because I've had folks in some of my town councils. I mean, when you think of wells going dry and water problem and us being in a drought, you would think unilaterally through the county, they would want to kind of come and advocate for the water drying up, even in this capacity, even though it's not affecting them in their areas. It's still our water. We're worried about water, right? So thank you for that. I also would like to highlight that I know when it comes to the CHI or the hitch, there's a project I know the Blue Ribbon Committee had passed for the Kelsey Creek to work. I think Sarah Ryan's part of that. So that's one of them. I know I was working on one as well, but I know that the Water Resources has something working with the Middle Creek. Those are all, they're held back by the state right now in some of the licensing. So I know that once those are cleared, that'll provide another area for the hitch to spawn. So that's going to be a big help.
Yeah,
so,
and then just to add off of that, Chair Crandall, you know, the projects that we did, so we have an entire section in our GSP of projects that we have promised upon ourselves to conduct in X amount of years. Once this GSP is approved, if it is so, we have a better chance of obtaining that funding. If it's promised in the GSP, then we are promising ourselves that we will do this. And again, going off of what Supervisor Sabatier said, outlining those gaps as well, we are committing ourselves and holding ourselves accountable to collect the best data possible to get the proper people to the table. So.
Okay, thank you. Is there any other questions? Supervisor Sabatier, then 1 second.
I just wanted to add, William said something that I've been kind of saying to a lot of people, that kind of like any other infrastructure, kind of like any other building or anything that was put together at one time requires maintenance, and just because your well has gone dry, there may be the need to inspect the well for fixes, upgrades, or repairs. It's not automatically just because the water has gone down. Over the years, many years, silt builds up and builds up, which increases or actually decreases the amount of feet that it goes down. And so there's just all kinds of things that could go wrong. And so I'm glad that you made that statement. Thank you very much.
Thank you.
Doesn't mean that it's the only reason, but there's definitely the potential.
Joan, I closed public comment. However, I know that you were working with the group, so if you can keep it brief, please come forward and let's see what you have to say.
One question that has not been answered in my mind was what I mentioned at the last public meeting about this, is are members of the committee under restriction by the Brown Act? There's a man who...
Yes, they are.
They are?
Yes.
So they cannot talk about it to the public or to each other?
It's covered under the Brown Act. I know that because I read through the minutes and they talked about that.
They are? Because, okay, that's what I want to know.
Thank you.
I'll get that defined at the next meeting. Thank you.
But that doesn't eliminate them from talking to the public.
1 second, I know that Ms. Grant.
Well, an open and public meeting by its very nature means the public's allowed to be present, so I'm not sure what
confidentiality would be applicable. I can't believe there's any closed session that would be appropriate for this group.
None of it was closed session. A man said, I've been given a gag order and I'm afraid of violating the Brown Act.
Okay, I don't know where that's coming from, but reading through the minutes, there's just, covering the Brown Act, you can't speak with certain folks or more than one person.
I'll try to
It's
get
just-
that fixed by,
Right.
by whoever
Have that person come forward and.
well, he did, and it was a public meeting, and he cannot talk because he thinks he's subject to the Brown Act, so I'm talking for him.
Thank you.
As a member of the press, I can say
Okay,
anything I
Joan,
want.
thank you. Thank
Just
you.
to be clear, members of the press have the same rights as members of the public. It's not an elevated right, but also to be further clear, an individual is not subject to the Brown Act. Your board is subject to it as a collective, and each of your members can violate it, but a private individual has no such compunction.
Thank you, Ms. Grant. Ms. Delagiannis, please go ahead and continue.
Yeah, so with that being said, if there's no more comments from the GSA or from the public, we are hoping for adoption today of our groundwater sustainability plan, if the public hearing is closed. So with that further ado, I'm going to pass it over to you, Mr. Chair.
I'll close the public hearing, and it looks like actually Supervisor Pyska has something to add.
I want to thank you for all of your work, and I also want to thank Sarah Ryan for her comments. And, you know, this is not a perfect process, but the important thing is that we're moving forward. We're committed to the work. We all have the same priorities. We want sustainability. We want the hitch survival. We want all of these things, and we're going to continue to work together and move through this and upgrade and adapt and evolve as we go. So I'm supportive of this, recognizing that it's a work in progress, and we're all committed to continuing the work.
Thank you, Supervisor Pyska.
Thank you. Supervisor Simon.
Yeah, want to thank everybody for the hard work, you know, to bring this to today. And once again, too, to do the same thing as Supervisor Pyska and Sabatier and everyone who's acknowledged the letter from Big Valley. Sarah, I know we got work to do. You brought up some very good points in your letter as we move forward. It's a partnership here at local government, our local stakeholders, that we move forward. EJ's tribe probably has a name, Cots. That's what we call the hitch here in Lake County for Middletown people, Kotsatau. You know, it's a part of our history and our culture. It's a part of who we are. I don't know, you know, I know myself as a young man was able to experience harvesting the hitch and drying the fish for our needs as a tribe. We don't get to do that anymore. So bringing and saving that piece of who we are as the natives and the indigenous people here is very important. So Sarah brings up a huge issue for us as natives here in the county. So the collaboration between the county and the tribes in this nation, I think, just need to continue to grow. I've heard that there are opportunity for projects and helping move things forward. I think this is one step of that. And yeah, nothing is perfect. So, you know, it's very important to us that we do this in collaboration with all stakeholders, because we know farming has been happening, you know, for the past 400 years in these basins, but for thousands of years, life was sustained off of this natural lake and the hitch that we're here for the native people. So very important that we always keep those in mind. It's not just losing a species, it's losing a piece of the people that come from this land. And it's very important that we always remember that. Just as some of our languages had to be revived here locally, which we have 7 dialects that were spoken here across this county, are, you know, just something that we always remember. And I know coming from the tribal side, who appreciate the collaboration to having the tribes at the table, you know, and the other stakeholders to talk about these very important issues. So we got work to do. And I'm glad to hear that there are opportunity for more public comment and more collaboration as we move forward. So thank you very much.
Thank you, Supervisor Simon.
Right. And so it looks like we have no other comments, and I think we can, we'll look for action.
I believe there's a resolution.
Right, there's a resolution, so.
Go ahead, I'll first.
Offer the rest.
Just offer it.
I think you can just offer the resolution as described in the staff report.
I'll offer the resolution as described in the staff report.
Resolution has been offered. Johanna, can you please conduct the roll call?
Okay, Supervisor Simon.
Yes.
Supervisor, sorry, I lost my train of thought. Supervisor Sabatier.
Aye.
Supervisor Scott.
Aye.
Supervisor Pyska.
Yes.
And Supervisor Crandall.
Aye.
Thank you.
Thank you very much.
Thank you
very
so much,
for that.
everyone. I'm very looking forward to the next steps in this. So thank you, everyone who participated, and this is a big, big milestone for us. So thank you all for your time.
All right. Excellent.
Great job, Marina.
So with that, it looks like we have we're behind on our 10 o'clock, which is a 6.5, and just briefly before we cover that, wanted to look at, so once this is finished, we have, I think, 3 more before we go into closed session. Are we okay with moving forward with these 3 or 4 items before lunch, or? Yes, it looks like we have head shaking, yes. So we'll go ahead and move on to item 6.5, public hearing. Consideration of resolution regarding vacating a roadway known as Dillard Avenue. And it looks like Scott DeLeon would be introducing this, and you have the floor, sir.
Good morning. Thank you very much, Board. Scott DeLeon, Public Works, Water Resources Director. Today's item is a public hearing for your board to consider a request for the vacation of a public road known as Dillard Avenue. Dillard Avenue was created by a subdivision map in 1923. It was accepted as a public roadway and was part of the county-maintained road system. The area that is being requested to be vacated is 20 feet in width and approximately 400 feet in length. There are some maps that were attached to your board packet that gives a little overview of the road and the parcels. The Streets and Highways Code provides a process for the vacation of public lands and easements. The applicant, Lori Doring, owns all of the properties surrounding the road, and she has cited vandalism and theft, absence of public necessity, private safety concerns as the justification for the request. The Planning Commission has considered the request for vacation and determined that it is in conformance with the general plan. This morning, should your board decide that based on the evidence that was presented, that Dillard Avenue is unnecessary for present or prospective public use, then your board would then adopt the resolution of vacation, which is also attached to your board memo. With that, I'm happy to try to answer any questions. I did look on the attendees list, and I did not see Ms. Doring's name as a list on the attendees.
She's here, and she's here. She just.
Oh, okay, awesome. Oh, that's right. She did say she was going to try to come in today. So the applicant, Ms. Doring, is present, and I'm sure she would like to offer additional information. So with that, I'll turn it back over to you.
Thank you, Director DeLeon. Would you like to come forward and? I will. I'll be brief. Mm-hmm.
So my name is Lori Doring. I'm the owner of Bellhaven Flower Farm, which used to be the Edgewater RV Park, and next to that, the Bellhaven Resort. So it's about 10 acres that's there on the lake, and we've made substantial from under the ground up improvements on the property. This road goes right through the 2 properties. So on a daily basis, we're going back and forth. It also serves as the driveway to my home. It hasn't been maintained by the county forever. It's composed of decomposed granite and dirt. So from the top of Hohapi, the cross street, there was a 14-inch drop onto this unimproved road. So that takes a toll on vehicles going up and down, as well as safety for my grandchildren to ride their bikes and scooters and all of that. So we've had several instances of theft because of the open access. We've lost our golf cart, several runs at our tools. we were restoring the pool on the area, and all of the equipment was stolen. And there's also, you know, it puts me in the position of having to be the security person. If people are there, you know, who are you and what's your purpose? The road dead ends before it even hits the lake, and it's 20 feet wide. At the end of that road, there's nowhere to turn around other than going onto the promenade, which is vehicles are prohibited, or my property. And I have in the past gotten a bit of joyriding going on, but mostly it's just that sense of, you know, you see beer cans and, you know, cigarette butts and all of that that does compromise my feeling of safety in the property and control over it. Mr. De Leon and I worked on an encroachment permit, you know, so I was able to improve the road enough to have it be safe. And, you know, just the county doesn't maintain it. There's 3 other roads, 1 block away, 2 blocks away, 3 blocks away, that are maintained by the county. They have turnarounds. There's access to the lake and to the promenade within, you know, feet from this road. So I'm asking for the vacation so that, which basically means the county gives over the maintenance of it to me, and I'll do that.
Thank you.
Any questions?
Are there any questions? Supervisor Sabatier?
I'm wondering if we can put up the GIS of this. Not sure if you guys want me to share or if someone else has that available.
If you can share it, I think.
And Mr. De Leon, can you repeat again what the length? I know you said it was 20 feet wide. What's the length again?
400 feet.
400 feet?
Approximately 400.
Okay. So 20 by 400 is 8,000 square feet. And as you can see right here, it's hard. Can we turn off the lights, please? It's still a little difficult. Let me blow it up a little bit more. As you can see, there's width between the parcels that are owned by the applicant. And if we vacate, my belief is that width just disappears because it's no longer a public road. I guess I need to understand, if we're vacating it, then we no longer own the land, because so I have 2 problems. My one problem is, if the land disappears and goes into the hands of the applicant, then I think that we need to look at what we did before in the Arabian lane, which was to kind of sell that property as well. I think that a 20 by 400 is 8,000 square feet. A typical lot, at least in the city of Clear Lake, I'm sure it's probably the same in many other places with high residential area, is 50 by 100, which is 5,000 square feet. So we'd be giving away more than a regular city lot to somebody here. And also, if we get rid of it, you have these properties on this side. What happens if the owner decides to sell one of these properties and there's no road access? Is that a problem in the future? Do we need to put some sort of like deed restriction that if there's no more roadway, that you can't sell one of those? I don't know. Those are my 2 issues. I think if I owned the property, I would request the same thing. I think the road looks to me to be useless, especially if you own all of those properties around. I absolutely agree with the reason for why this is in front of us. I feel like we're missing some steps where there's the potential of giving away public funds, gift of public funds. And I think that I just want to make sure that we do this correctly, that if this is vacated and this area of 20 by 400 disappears, that it's done in an appropriate way where we are getting our, the public is getting their fair share for what is done with this area. So those are my 2 concerns, is these properties here, what happens if they're sold and the road doesn't exist? Now it's just landlocked properties. Is that just up to the person who decides to buy it, that it's unfortunate? So that's my worry, is the future and the gift of public funds potential issue. And I'll go ahead and stop sharing the screen.
1 second. Director De Leon, did you want to add to that, or do you have anything to add to that?
Well, I will say that Ms. Doring and I have had a conversation about those two interior lots. And if that road is vacated, then yes, those two lots wouldn't have direct access to a public road. Perhaps one of the conditions that could be placed as part of this discussion, and I suppose we could even incorporate it into the resolution, but one of the potential options here is to just note that in the future, should that piece of property be sold, which, and I'll allow Ms. Doring to comment on what her intentions are with the property, but in the future, should something like that ever occur, then an easement to those properties to the nearest county road will be required, and perhaps that could either, again, be added to the resolution, or just simply through the notation of that as part of this public record, that would be sufficient, and I'll leave it at that.
Ms. Doring, did you want to add something?
Yes, well, I'll speak to that point and then your first point as well. So in general, I realize the need to keep it legal. So going into the future, we don't want to create complications with the properties. So I'm totally fine on making that contingent on adding an easement if those properties are ever sold. Just to describe those properties, they've been, although they're separate parcels, they've been run as one property forever, since 1940 when they were built. It's a family compound for us. We've invested a few $1 million in renovating that and the property next door for the purpose of having it be there forever. This is a legacy property for our family. So we're not going to be, piecing off parts of it and selling it. It's a whole. All those little cottages, although they're separately parceled, they all look the same. It all runs on the same, electrical, plumbing, sewer, all of that. Kind of a anomaly, really. So just with that said, in order to address the future, we'd be willing to do the easement as part of that if and when it's ever sold as parcels. The other thing is that your suggestion about financial remuneration, that was my first course because it's very simple, and I felt the same thing, like, here's the property, what it's worth, I'll be happy to take it off your hands. In working with Gordon Haggett as the county surveyor, the county doesn't own that property. He can't sell it to me if he wanted to. So the only designation that it has is that it is, in 1923, it was named as public access. So that brought into, the whole vacation, which I've been working on this for a year, as the avenue to make this happen. So, that's how that went.
And I get that it doesn't have a parcel number, so it's hard to say we're selling a piece of property we own. But again, by looking at the GIS map and in my conversation with Director De Leon yesterday, it is a public right-of-way, and your property doesn't go all the way to the middle of that public right-of-way. It stops at the edge. So it would be providing more property to your property, which is where I get a little uncomfortable.
Well, it doesn't, in the sense that I'm not adjusting lot lines. It's not, I don't own it. It's not for sale. It's not something that I can incorporate into my property.
And I get it that maybe map-wise, but if you put a gate in front, it absolutely becomes a part of your property. It more becomes your driveway than it becomes if we vacate it as a road. And so that's where I want to make this happen.
Right.
And it sounds to me like you're willing to go in the direction that I was asking about, where I feel a little uncomfortable. I don't know if that's what direction we will go. But I just wanted to express my concern with the fact that it is not currently a part of your property acres, and that it would be now usable properties within that compound that you have, where it would definitely, at least perceived, not sure if legally, would be perceived as a public gift of funds.
Okay. I'm not sure how to respond to that.
Vice Chair Scott, you had your hand.
I do. I have a couple questions. I've actually been down to the property, and those properties next door are definitely one piece of property. So I guess my question would be, have you ever thought about merging those? Because it is. If you go down and look, it's one piece of property. You can't even see where one stops and the other one starts.
Right. There hasn't been a pressing need to go through that process. The other issue about doing that is insurance for each property or as the whole. You know, if there were something that really warranted that time and money to do that, I would engage in it. So far, it hasn't become a situation that motivates me to, you know, go through that process.
All right, and then my next question is for Director Scott DeLeon. So if we were to vacate this road, that would not give this property owner right to do anything other than use this road as a roadway, right? She wouldn't be able to build on it. It's still not her property. It would still need to be a roadway, correct? Or am I wrong with that assumption?
Well, no, I don't think you're incorrect with that assumption. It's going to be a 20-foot wide by 400-foot long piece of land that, you know, to do something on would be extremely challenging. I mean, I don't know how you would get a permit to do anything there. Perhaps in the future, if they were to do a record of survey or some type of legal mapping where they adjusted all of the lot lines to either go to the center line or somehow change the boundaries, then it, I suppose, it'd be possible. But without that, it just as it sits, I don't see it as something that could be developable.
Right. My question,
other than what she's stated that she plans to use it for, and that is a driveway to the remainder of the parcel.
I appreciate that answer, because I think it goes back to Supervisor Sabatier's question about, you know, gift of public funds and giving up property, but we're not allowing her to build on it or do anything. And I think Anita has a comment, so I will pause. No?
Go ahead. I do have some comments if the board wants to hear.
Yes, Ms. Grant, go ahead.
Well, I think Supervisor Scott still has more.
Microphone.
Did you?
Supervisor Scott, did you know?
I will heed to you.
Okay. The only thing I can say is that all of this is doable, but I think there's some clarity that needs to occur here. Streets and Highways Code 8324 does talk about the resolution of vacation, may provide the vacation occurs only after certain conditions as required by your board have been satisfied. So I would not recommend at all that this just be a statement before your board. Anything that you want to incorporate would have to be in the actual resolution. I don't think you can do that off the cuff today effectively. I think it can be done for probably the next hearing, and I'm happy to assist with that language since it's essentially legal in nature. The other thing is, once the board vacates this property, the board has no control over it. Now, it may not be subject in its present condition to being developed, but that's not the same thing as requiring it to be continued to be used as a road. So there are some distinctions throughout this that I think it will help both the property owner and your board to have clarity on, so everyone knows exactly what's happening here. If your board wants to consider and discuss what requirements you want to include, I can easily incorporate those for the next board meeting on the 25th.
Who technically would own the property?
Well, the county at this point doesn't own the property itself, so I'm assuming the county just simply has an easement or something I'm not quite sure how the county has used this as a county-maintained road if the county doesn't. I mean, the county has to have ownership through an easement or an ownership in fee, i.e. the property surrounding. If it doesn't, then I don't know who actually owns the property over which the county has the road easement. Supervisor De Leon, or Director De Leon may know the answer to that.
Do you want to add to that before I move on to Director De Leon?
I'm sorry, I'm trying to look at the subdivision map. So you just have to give me 1 second here.
I can have my comment if you don't.
Yes, go ahead.
Okay. So I'm dealing with a lot of these situations in the aftermath of the fire. And Scott De Leon can verify that a lot of problems are kind of put off, kicked down the road because the clarity is not in the resolution. And we're working through some problems right now where things happened 10, 20, 15 years ago, and it wasn't really well documented, and there was uncertainty. And so I just really urge us to clean up the process, put everything in the resolution that we need to. You know, God forbid something happens to your property or your family. There's all these things that we don't know, and we just want it to be cleaned up for the next person.
Right. I agree with that.
Right. So, you know, one of the questions that comes up a lot is who actually does own this road that's not county maintained, or, you know, so I'm dealing with another road vacation process. They went and did all the easements and lot line adjustments before submitting their application. So that was several years of work. I'm not saying we need to go back to that. I'm just saying, you know, let's have a clear understanding, everybody on the same page before we move forward.
I like that. Director De Leon, I know that we stopped in the middle of you looking at something, so I'll let you go ahead.
I was just looking for the statement on the tentative map, and it simply says that the lanes, ways, streets, etc., highways delineated on said map are hereby dedicated to public use.
Okay, thank you.
Yes. Unfortunately, Mr. Haggett has retired, and he was the one that was working with me. He made several trips out there. He brought road crews, et cetera. And, you know, it's from him that I wasn't able to purchase the property, that it isn't owned by the county. The only thing the county has, you know, control over, and they're supposed to maintain it, which hasn't been done. So kind of leaves me as the property owner, you know, as the last person on that trail there.
Oh, I understand.
Yeah.
Did you have something else, or would you?
No, I greatly appreciated Anita's comments. I think you bring up some good points, Supervisor Sabatier and also Supervisor Pyska. It sounds like, at least from my point of view, I would like to have it right. After the Valley Fire, obviously I dealt with multiple issues in the Anderson Springs area, and I'll tell you, Gordon Haggett was a great resource to help get some of those things done. And I think the one I dealt with happened in 1951 and hadn't been completed for, you know, so anyway, we got that taken care of. So for me, you know, I'm in favor of what's being asked for, but I want to make sure that what we do is very clear in the process going forward. And I think I've heard you say you would like to have that too.
Absolutely.
If we're willing to do that and move it forward to the 25th with some clarity, that's my thoughts on it, so.
If I might, just,
Go ahead.
well, we've had this discussion. I think we've come to some terms on that and agreements for what the concerns are and how to address them. So I don't know if there's anything outside of that. Just saying.
Okay, Ms. Grant, go ahead, and then Supervisor Sabatier, you follow.
I don't know if there's anything outside of that either, but I do recommend now would be the time to look, as your board's indicating. I would also say that Supervisor Sabatier had brought up Arabian Lane and that property, and there was a sale of property under 8355 of the Streets and Highways Code after your board did declare the property surplus and vacated the road. In that case, it was if a legislative body of a public entity determines that property previously subject to a street, highway, or public service easement, title to which is owned by the public entity, is no longer needed by the public. And then the section goes on to authorize the exchange or purchase. Obviously, a property like this has very limited value, I would think, but that begs the question of exactly how this property is. The county must have some means of having incorporated into its county-maintained road system. And so that really does need to be presented to your board so that you understand what actions you're taking and the consequences. But as I said, I foresee no problem in having that ready for you for the 25th.
Go ahead, Supervisor.
I would like to get to the bottom of who owns these roads. Because this keeps coming up over and over. I want to thank Ms. Doring, because this is not the first time that you have brought to the county a complicated issue, and it's been a learning experience for all of us. And I appreciate your patience. But as I mentioned, I have a vacation happening, and the same questions are going to be coming up. And, you know, I think this is the best time for us all to get on the same page of, you know, who owns the property. If there's going to be a vacation, does it end up being a purchase because of the public access issue? And maybe we can just take that time now to clean up our process.
I like that, and also taking care of problems for the future so it doesn't happen for future generations. Supervisor Sabatier, can you please go ahead? You've been waiting, and I'm sorry for passing you up a couple times.
And I think at this point, I might just be repeating things, but I know that I heard Director De Leon say that it was publicly given public access. Can you repeat what it said on the subdivision map?
Sure, 1 second.
Like dedicated for public use or something like that.
Right. That the lanes, ways, streets, and highways delineated on said map are hereby dedicated to public use.
And so I guess the thing that I think we're all asking the same thing, but I need to know, does that mean it's a easement where then you are on top of someone else's property, like a layover map, rather than an actual separated piece of land that is its own thing called a road? Because I think that's where the difference would lie on my comfort level, and I get it. I think it would be ridiculous to do a full-on appraisal if it does end up being a piece of land rather than an easement, because the appraisal would be more expensive than the piece of land is valued itself. But at least, even though I hate making an argument for just a few $1,000s, it's, in my opinion, the right thing to do for the public, that it is right now owned by the public, and we need to make sure that we do the right thing. And as far as the addition to the conditions for the future in case a property does get sold, as long as county council is comfortable with that, I'm comfortable with that, that it does secure for future use so that it doesn't become a landlocked piece of property.
Right. Okay. So my question to you then is, who makes that decision? Because I've already explored it all the way through legal, through planning, through roads, everything, and didn't come up with an answer. So who's going to make that determination if it hasn't been made already?
I think we're going to have to dig into some of the subdivision maps and stuff, but unless you have a piece of property that shows on the description of the property that there is already a dedicated easement, which my gut feeling is that it's not going to show up as such, that it is a road that is publicly owned by the county, not as a parcel, but as a lane, road, highway, or what, because none of our roads have parcel numbers. But if we got rid of Soto Bay Road, we'd have to do something about that.
Right.
And can't just give it away to the property owners aside. There would have to be some kind of financial value set aside for that. So I think that's what we need to come to was this provided to the county as an easement to access a larger property that eventually got split up, which doesn't look like it since we have the subdivision maps, or was it a road itself that was dedicated as county public land, specifically as stated in the subdivision map? And I'm not going to make a statement that it is one or the other, but I think that's going to be the study that we need to make.
Okay, so that comes from 1923 is the how that all happened.
Vice Chair Scott, you had your pen up.
Yeah, I guess I just have the question, if Supervisor Sabate, if you could bring the map back up. Now, the road doesn't go all the way to the lake, right? So it's not, this road doesn't have
It
access.
hits another road, Soda Bay Drive.
No, but on the other side.
The Esplanade.
Isn't that your property that it's hitting all the way around? So it's not like it dead ends for lake access, correct?
No, it's impossible.
Yes,
because
they can't get to the lake. So it's not like we're eliminating the access to the lake.
No.
The access is just the road. So we're not really public access.
It would stop right about here where my cursor is, I believe.
Yeah, so we're not eliminating the public to access anything because there's no lake access, which I think would be a different issue if that was the case. So again, I agree with this. I would love for County Council to go back and look at it to clarify and then bring this back.
This gentleman right here had his hand up, and can you come to the microphone and state your name for the record? And
Jeff Manch, Homeowners Association. That road was, when I came here in '97, along with the other accesses to the lake and the promenade, which is about 1,800 feet long, and that's an access to it. I have no objection to her using that road and keeping it for her personal use, as long as the rest of the homeowners can use it as well.
Thank you.
Because it is a way at each end of the promenade that 3 times, 4 times a year that we go in and do our cleanup. The last couple of years, we haven't been doing much because of COVID, but we're going to try and get back on it again.
thank you for that. And I think so where we're at, it looks like we need to bring this back anyhow. And so it looks like we need to prepare some more paperwork and get this ready, or not paperwork, but for the resolution to be, go ahead, Supervisor.
Is there an agreement with the homeowners association to come in a few times a year for cleanup?
I'm not aware of that. I do all my own cleanup. It's the most sparkling area in Soda Bay.
She does keep the spotless, and she's on the board.
I'm on the board of the Soda Bay Homeowners Association.
Okay, so
I'm a director.
If we're going to speak, we need to be at the microphone, so, yeah.
Lori joined the board this last year, so yeah, there's no problem with that. Like I said, if she wants to gate it, as long as we have access, key in, key out, the fire department can have key in, key out. The promenade is only to be used for the public, not for vehicles, but we do allow a vehicle periodically for cleanup.
All right.
Okay.
Well, and just again, looking forward to the next people, if that's an agreement, maybe that should be in the resolution too.
Right, which we've discussed, that those properties that would be losing access, there's 2 of them, would have built in an easement to be able to access it.
Supervisor Sabatier.
I'd like to ask County Council, do we put in HOA agreements within our own resolution, or is that a separate agreement that they just make themselves with the property owner? I'm not sure.
Ms. Grant.
Thank you, Mr. Chair. Well, the HOA obviously has to make its own agreements, but the resolution can contain the board's understanding at the time you approve things. So, again, there's language for all of this once it's understood just exactly what the landscape is in terms of what, if anything, needs to be addressed. But I think probably your board will be in a better position when more information comes back to you, because right now it's a little bit of a guessing game.
Okay, thank you. And so that's, I think what we'll do is get the information and come back together. Someone stated the 25th, right? Something like that during that meeting. And it looks like that's what we'll do. Thank you for your availability today. And Sir Supervisor Sabatier, did you have something to add?
I just want to make sure that we're getting the information we're asking for. We want to know if it's a road that's owned by us or whether it's an easement on a property that is not owned by us, but giving us permission to have as a road. And then also the exact writing of the condition for the future potential sale of one of those properties that would not have it. Is that all we're asking for?
I think there's more, I mean, more or less, so that's what we're looking for, right, Ms. Grant?
Yes, sir. Depending upon the information, I may have additional recommendations. Obviously, it's always your board's decision what you decide to do.
And I'd like to add one thing. If it is land that we own as a road that splits in between those properties, just so that we can get to a final position to make a decision, I would like to know what we value that so that we can go ahead and finalize that. Like, what is the value of that land?
Go ahead, Ms. Grant.
I think you could probably ballpark that, sir, but you wouldn't be able to have actually a definitive in 2 weeks. May I suggest that since this was a public hearing, that you just continue the public hearing to is on the 25th with a time certain?
Yes. If that's, see, everyone's fine with that?
Just ask
Looks like
Johanna.
they are. But would you be amenable to this as well? I think so, okay. And Director Joy, are you sure? Okay, I'm getting nods everywhere. All right, it looks like we have a path forward, and that's what we'll go ahead and do from here. And
So we just need a time.
And if we could check in with the Assistant Clerk of the Board, too, about the timing for that date. According to my notes, I don't show that we have any timed items that day yet. Johanna, do you concur with that?
Yes, that's correct, except we have one proclamation in the morning.
Okay. So, Mr. Chair, we do have things that will be on the agenda, but so far nothing else competing for timed items. So you might select, I don't know if you're thinking you would want us to try to schedule another COVID update. If you are, we would put that on fairly early. And so you'd probably be looking at this item around 9:45 or something like that.
that's what I was thinking. Does everyone feel okay with that?
Would you do that by motion?
Yes, so if someone would
So
like to.
I'll make a motion to continue this public hearing to January 25th at 9:45.
Second.
So I have a motion and a second. Joanna, please conduct the roll call.
Okay, Supervisor Simon,
Yes.
Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Aye.
Thank you.
Thank you. And thank you for your time.
Thank
you,
you.
Director De Leon. And it looks like we are at 12:29.
Mr. Chair, could we check in a little bit about the timing and how you'd like the rest of the morning agenda to go?
Yes, that's what I was just going to ask.
Okay. So it appears we have four additional untimed items, including your calendars, and then you have a closed session item, which is an interview for the Ag Commissioner position. I have the candidate waiting for an update from me in terms of when you would like them to come. So are you thinking you want to just power through or take a lunch break? I suppose an advantage to powering through is that you also have the evening joint meeting with Lakeport, and you'd have a longer break before 5:30, so.
So I'll look to my colleagues.
I'm hungry.
I'm okay with going through. but
I'm
it's up to
okay either way.
Yeah, let's power through it.
I'm gonna need a snack break then.
Got almonds?
Oh, there's
I have my
donuts back
almonds.
there.
I've been eating them.
There is, but, okay. But I'm also thinking about staff, so, staff's okay.
So we're fine, but maybe a 10-minute break?
Let's take a 10-minute break right
And-
now, and then we'll power through from that point. How's that?
And, Mr. Chair, what would you think about me telling the candidate to be ready at, I'm thinking about 1:30, does that sound
I
right?
think we can handle that, yeah. I think we'll
Okay.
make it happen.
Thank you.
Yeah. 1:30, so we'll have them ready at 1:30. And, okay, 10 minutes from now is 12:41, so we'll be back by then. Thank you.
Get donuts, go eat a donut.
Welcome back. Okay. Would we want to start with 7.2, or are we ready?
I believe HR Director Pam Samek is here to present that, yes.
Okay.
So if you'd like to introduce it, I think
So I
we're
will
ready to go.
introduce 7.
She's been here for hours.
Oh, thank you for bearing with us, Pam. Item 7.2, consideration of amendment to the County of Lake COVID-19 Public Health Emergency Worksite Protocol. And
Thank you, Mr. Chair. So as you know, I'm introducing Pam Samek, our HR Director, who's going to present this item. Pam has taken the lead role in recent months, I should say, to keep this protocol updated. And so go ahead, Pam.
Good afternoon, Board. Today, for your consideration, we are submitting updates to the COVID-19 protocol, which address the updated isolation and quarantine recommendation, exclusion pay for workplace exposures, masking, and updated COVID forms. Cal OSHA will meet later this week to update the ETS and discuss the vaccination and testing mandate. They have not addressed the vaccination mandate as they are waiting to see how the Supreme Court will rule. So when they meet later this month, we will update the protocol as necessary, based on what they decide. So currently today, we're looking at the updated isolation recommendations for the CDPH and the CDC, which states that an employee that tests positive for COVID-19, regardless of vaccination status, previous infection, or lack of symptoms, must isolate for 5 days. They can end isolation after 5 days if no symptoms are present and they have a negative antigen test. They are stating that they prefer the antigen test. If the employee chooses not to test, then they must stay home for 10 days and can come back to work as long as they have no symptoms. If the employee comes back to work earlier than the 10 days, they must wear a well-fitting mask for a total of 10 days since they were exposed. We updated the quarantine recommendations. This is a big change from previous guidelines. Now, if an employee that is unvaccinated or vaccinated and booster eligible but have not received their booster dose and they get exposed to somebody with 19, they must stay home and quarantine for 5 days. They can end quarantine after day 5 if there are no symptoms present and they test negative for COVID-19. If they choose not to test or they cannot test and symptoms are not present, quarantine can end after day 10. Again, the employee must wear a well-fitting mask for 10 days since their exposure. We also updated the quarantine recommendations for employees who have been exposed, who are vaccinated, boosted, but are not booster eligible yet. They do not have to quarantine, and the major change here is they must test at day 5. The second big change here is they also must wear a mask for 10 days, especially in indoor settings. If they test positive, then they must follow the isolation recommendations above. If they develop symptoms, they must stay home and test. We've added exclusion pay benefits for employees exposed at work. Exclusion pay will be provided to employees who are exposed at work and are unable to telework during the quarantine and isolation periods. We updated the masking recommendations as the CDPH has extended the mask mandate until February 15th. Everybody in California must continue to wear a mask indoors and at work. We updated the forms to improve contact tracing information collected and help us determine close contact and work exposures. Thank you.
Thank you, Pam. Is there any comments that Supervisor Sabatier?
Yes, I had submitted some suggested changes, and I know that some of those were approved. Wondering if that can be discussed, just because it does change a little bit, not too much. Some of it are just missing portions, just wondering if that can be discussed.
Sure.
Pam, I'll try to pull that up quickly too.
Yeah, thank you.
Let's see.
And while you're looking for that, I'll just state that I appreciate seeing the exclusion pay. That was one of my questions, and now it doesn't really necessarily need to be answered, so.
Okay, so I found them. So first of all, maybe we should do a share screen of the protocol. That might be helpful. So Matthew, can you put up the protocol?
I don't immediately have it. I will.
Okay, let me find it there too. So I think that might be helpful. It's going to take just a moment because I didn't have that.
I'd like to, if you'd like me to share my screen?
Yeah, Bruno, if
Yes,
you've got it handy, yes,
Supervisor
because
Spackie,
I didn't
thank
have
you.
it loaded on my screen, so thank you. Okay, Bruno, if you would do me the favor of going to page 4. Okay, so there's a sentence fragment right there in the middle of what he's got posted. It says, unless exempt, all Californians must wear face coverings as defined by, and what's being added in the final version is by state guidance. Those two words somehow got chopped off. And then Bruno, Supervisor Spatier, you also had a question about some language on page 7. If you could move forward to page 7. You thought that some of the language didn't make sense here about physical distancing and vaccinated versus unvaccinated employees. This language talks about physical distancing for unvaccinated employees, and you had questioned what about vaccinated people? And this language dates back to the time when vaccinated employees did not have to mask. Remember those days? There was a short window of time when they didn't. And so that's why vaccinated folks aren't referenced here in this section. But it's staff's recommendation that we leave this as is, because we're ever hopeful that we'll return to those days on the other side of this surge when vaccinated people no longer have to mask. And so then also on page 7, it's a little further down where it says during the public health emergency. Thank you, Bruno, for doing this.
Where is that?
Right
There,
there. Right there.
there you are. Based on Supervisor Sabatier's suggestion, we are deleting the term unvaccinated employees in that first line there, because this does apply to all employees. And then moving on to page 8, and it's the section that says employees who are exposed to someone with COVID-19. It's the quarantine section. Okay. So the supervisor was concerned that at the end of this, we should state that this applies to 6 feet or greater for 15 minutes in a 24-hour period, but we actually pointed out that it's at the top of the section. So our hope is that that would be adequate.
And that one, I just misread it. I think the 6 feet 4 is what confused me, because I was thinking it said 4 greater for 15 minutes, but it's 6 feet or greater for 15 minutes in a 24-hour period. And once that was called out for me, I was able to better understand what I was reading.
And so then on page 10, where there was reference to OptumServe, and you know, there just have been so many changes throughout this. I thought off the top of my head that OptumServe had been, was no longer active. I know they're active for some things. And so Director Samek went online and found that Public Health still had them listed as being active. Pam, did you follow up with Public Health to get the latest on OptumServe and whether they should still be included here?
That is correct information as posted.
Okay, so it is correct, okay. And then last but not least, there was a question about the addendum, which you won't see on this document, but there's an addendum that we've been using for a number of months to report workplace exposures. And the question was, do we need to continue using that? And the answer is yes, we do need to continue using that. It's less about track and trace than it is about helping us to determine if an exposure occurred in the workplace, and if so, if it would be covered under workers' comp, or if exclusion pay is in order for that situation. And so this is a Cal OSHA requirement as investigation of a potential exposure.
Thank you for reading through that. And the last part about the addendum, if you go through that application, it's not exactly a small, quick application. There's definitely quite a lot of information that is being requested. And I was just looking, especially with this surge, when there's so many people that are going to get the virus, and hopefully without any severe symptoms, it still is going to create a lot of bureaucratic paperwork in our office. And I was wondering if there was any way to bypass that or minimize that. And it seems that it's kind of the protocol we have to follow for workers' comp and for everything else that was already discussed. And so appreciated the feedback that I received. And also just a thought for the next iteration. It doesn't have to be done now, but if we could just put when it comes to our testing and our vaccinations, if we could just put a direct link to where that information should be up to date on our website. That way we don't have to keep updating it or changing it on our actual written policy. I think that would be a whole lot easier just to point people in a direction where it will keep updating rather than keep updating the document itself with those specifics.
Sure. We can make that change. However, when we post it on the internet and it becomes a PDF document, sometimes those links don't always work. So I could include a web address where they could copy that and then, put it into their search engine.
Yeah, if there's a will, there's a way.
Sure.
Thank you.
So that is essentially it for today with this protocol, but we're definitely on a path for changing it considerably more, as Director Samak mentioned, depending on how fast Cal OSHA moves, quite possibly as soon as the 25th, if not, though, certainly in early February.
Ms. Grand, did you have anything to add? No? Any other questions or concerns? I don't see any pens up. We'll open it up for public comment. And Sam, if you can get the lights for us, please. Thank you. I do see that we have a hand up. We have Sheriff Martin. Sheriff Martin, if you, we can't hear you just yet. I think you're still on mute.
How about now?
I hear you now, and so we won't worry about 3 minutes. Just go ahead and give us your insight.
Thank you, Mr. Chair. Good afternoon. I've already received a bunch of inquiries about these exclusion pay. So if we could discuss that maybe a little bit more for clarity on what the exclusion pay is, where does that time bank come from? Is it a requirement that we allow our employees to use sick time? Are there limits on the amount of exclusion pay? I think there's just a lot of questions surrounding the exclusion pay. There's also some other questions I think that we'll probably discuss at a department head meeting here soon about what is the criteria for when somebody tests positive or negative. Are we going to require employees to provide some certification by the person that administers the test? Are home tests authorized for use? Do we just rely on the employee, kind of the honor system to tell us whether or not they've had a positive test or a negative test for purposes of determining what their protocol is going to be on returning to work or the conditions on their returning to work? And the last thing I want to touch on, I see in the appendix is that there still exists the exception for critical infrastructure and workplace shortages and outbreak. I want to make sure that this protocol doesn't impact that addendum, particularly for our operations and public safety.
Okay, that was a lot of questions. We'll start with exclusion pay. Exclusion pay is paid only if there is a workplace exposure and it's not covered under workers' comp. So generally that could potentially be for quarantining if it is a workplace exposure. But if you test positive and it's a workplace exposure, then workers' comp covers that. This covers quarantining when it's not a workers' comp, and through the investigation, it is determined that you were exposed at work. So, for example, your child comes home sick, and you get positive because you were around them, you're not going to be paid exclusion benefits because it was a non-workplace exposure. So that's why the investigation forms still need to be filled out, because we need to make a determination as much as we can where the exposure took place and whether or not workers' comp applies. Now, if it was a workplace exposure and, like, say it was myself and I can work from home, you wouldn't be paid exclusion benefits because you can work from home. So it depends on the circumstances.
So if somebody is quarantined and the investigation is not complete before the end of the pay period, do they just take sick time and the employee is to try to recoup that through some other process other than through the department directly?
Yes, we would, they would take sick pay, and then if it was determined it was workplace, just for timing purposes, then we would return their sick pay through a payroll adjustment.
Okay. And then my next one, I'll re-go over my questions because I know I did fire a bunch of questions off at you, and I apologize for that. As far as testing, we have people that are trained to administer the tests in our department. We also have people that do home tests and are indicating they're either negative or positive based on their home testing. Is there a standard that we're going to follow countywide, or is that kind of, how's that?
That's kind of it's in development, and I am working with health to kind of come up with a procedure for that. If we sent tests home and like your people are testing at home and they test positive, generally we accept that test as being true. When it comes to the retesting at day 5, that's where I'm working with health to develop a procedure. It may be a FaceTime type of procedure where the test is administered and done via FaceTime and you watch, and then, if it's negative, they're able to return to work. Because what we don't want to do is have employees return to work to test and potentially then expose other individuals. And so I was trying to get a couple of tests per employees. I don't think we're going to be able to manage that. So what I'm most likely going to do is send tests to each department. If an employee is positive and they don't already have a test, then we will mail tests to them so that they can be tested on day 5. We'll go through that procedure. Again, it's kind of like Groundhog Day. If they test positive, they're going back in for 5 days.
Okay. And then my last question, I think this is probably an easy one. I just want for clarification. On page 2, it lists the addendums. The addendum for critical infrastructure staff shortages and outbreaks, this doesn't amend that at all, does it?
It doesn't amend that, but if, again, Dr. Pace kind of needs to sign off on that. You need to request from him that this is a critical infrastructure period, and he approves it. It's not like carte blanche for, 90 days. It has to be for a certain period, and he has to make that judgment call. But I know he's not denied you that ability in the past, and so that won't change. You're the only department who can, at this point, use that critical infrastructure exclusion.
All right, and that's all I have. Thank you for your work on this. I know it's a monumental, never-ending task. Thank you.
Thank you, Sheriff Martin. Are there any other comments or questions? Or Supervisor Sabatier?
I'm hesitant to make the comment, but I'm going to make it anyways. This protocol somewhat changes the, it has slight leanings towards a change of employment situation where we're asking. I don't want to do this today, but in the next iteration, which obviously it seems like in February or maybe a little bit later, we'll see something. If we can at least share this with our unions so we can get some feedback, it would be really nice to make sure that, unless that's already happening, but because we are changing our behavior in what we're asking our employees to do, it seems to me like it would be really wise to make sure that we stay with the unions and let them know what changes are happening so we can get their feedback as well. And please correct me if that's already happening. And I don't know if it needs to be a, I'm not getting the term right, something that...
Meet and confer is the term you're trying to think of.
Say that again?
Meet and confer.
Meet and confer, thank you. Yeah. I don't know if it requires that, but at the very least, I'd like for this to be shared ahead of time so we can get their feedback and possibly either clarify or make changes based on some of their feedback. But I just...
And I have been sharing it with the unions. I regularly talk with, especially 3, 4, and 5 as our biggest union. What I have been told that, if it is an OSHA our Department of Public Health standard, that they will, they have no problems with us implementing that. But yes, we can, when there are substantial changes, send it to them ahead of time. If, say, for example, the testing and vaccination mandate was to be handed down by Cal OSHA, that would definitely require a meet and confer with all of the unions, because that would substantially change work conditions if that mandate did get handed down. And right now we're still in a wait and see, and we'll go from there. But absolutely, that is our process.
Thank you so much.
Thank you. Any other questions? Okay, so I'll open it up for public comment. I actually did already. Is there anyone else on public comment? I don't see anybody. 3, 2, 1, bringing it back to the board for action.
Mr. Chair, I move to approve the revisions to our COVID-19 work protocol with amendments.
Second.
I have a motion and a second. Joanna, please conduct the roll call, please.
Okay, Supervisor Simon?
Yes.
Supervisor Sabatier?
Aye.
Supervisor Scott?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye.
Thank you.
Next is our 7.3 item, reconsideration of temporary closure of Board of Supervisor chambers for in-person meetings. CAO Hutchinson.
Thank you, Mr. Chair. I wish we weren't back having this conversation. I have to start by saying that. As you remember, just about a year ago, or a little more than a year ago now, your board took action to temporarily close the board chambers to further the safety and well-being of employees and the public. This was based on a growing number of COVID cases in county facilities at that time. And following the direction you gave on January 5th, 2021, our offices remained open. This was in contrast to the initial shelter-in-place order in March 2020, when all of our offices were closed to the public. Instead of the full closures a year ago, we reduced our in-office staff density, making the transmission of the virus hopefully less likely. Remote work agreements were utilized where it was appropriate for staff to partially work from home. And then later in the spring and summer months of 2021, the conditions got better, and your board reopened the chambers, and most county offices returned to work full-time in their offices. So at this time, in light of the impending Omicron surge, I'm asking you to look at that again. And then also to consider reminding department heads of the authority they already have under our remote work policy to direct employees to work remotely to the extent possible and reasonable until conditions improve. The timing of when to bring this forward to you is really difficult, especially when we're talking about a virus that seems to move as fast as Omicron does. If we wait till things are completely out of control, it's like we have waited too long. But I will say that since January 4th, I'm aware of 17 employee positives coming in as recently as this morning. I also know that we have a low vaccination rate among our employees with, that is less than 50%, which is less than the general public, meaning that we're probably more susceptible to transmission. And I will also say that over recent months, it seems pretty clear that the vast majority of participation you're getting in board meetings is coming to you through Zoom. Most of the commenters and attendees are in Zoom, probably in the 90% range. So, so my recommendation today would be that, that you consider closing your chambers, that you determine that you're going to reevaluate the action you take, and no less than every 30 days. It could be as often as every Tuesday that you meet, if you so choose. If you don't feel inclined to take that action about closing the chambers, then I would ask you to perhaps consider doing so for meetings when we're sure there's going to be a lot of people in the board chambers. And I want to call your attention to the upcoming one on January 20th, when you're going to have your annual governance workshop. And we expect at the very least that all department heads would be in attendance, which would put us pretty much at capacity for this room, without also bringing in some of the public. And so for that day, if you proceed with doing it in person, we had the thought that we could utilize the television that HR has in the lobby and also set up some seating out there. But the desire would be to bring department heads in here, 21 of them, I believe, including Anita and I. And then if more members of the public are wanting to attend, the capacity in here, I believe, is 24 or 25. So you'd have room for a few more public, and then if necessary, seat a few outside. But bringing a lot of people into one room is a big concern. We have one situation where presently, where in one department, 6 or 7 employees have tested positive, and those employees attended a large meeting or training together. And so, so that's what I have before you, and look forward to your conversation, discussion, direction. And at the very least, I do ask that you remind department heads of their authority to have people working remotely as much as possible right now, but keeping offices open.
Thank you, CEO Hutchinson. It looks like we have a comment from Supervisor Pyska. Go ahead.
I don't feel like we need to close the board chambers at this time. I mean, it's only 7 of us in here right now. Occasionally we have a handful of people. Everybody is following the protocols. Everybody is wearing their masks. Everyone's spread out. It's not a perfect situation, but it's as safe as it can be. You know, when talking with the positive cases at the schools with students, the thought is that the infections aren't happening at school. They're happening at homes, and then people are, you know, they test positive and so they get sent back home. And I feel like that's also what happens when our, you know, when staff and employees they're likely getting infected outside of the work area. But I think, you know, asking department heads to do what they feel safe based on what they've got going on in their offices, they know better than we do, and allow for work from home if that's possible. We are experiencing a tremendous loss in our staff right now in productivity, and that's really, it's really unfortunate, but it's the reality of what's happening. But as far as our chambers, I feel like this is a very safe place. When we were talking about next week for our department head meeting, we could have the department heads in here, or we could have them call in. I think there's more options that we could talk about, but keeping the chamber open, you know, for our transparency, you know, I feel pretty strongly that we shouldn't close it at this time.
Vice Chair Scott.
I agree. I don't want to close the chambers, maybe limit the amount of people that are definitely in here. Maybe all 5 board members don't need to be here at one time. Maybe have the chair and the vice chair be here if the other ones want to Zoom in. Talking about next week, I definitely think we need to have department heads Zooming in. again, we could have just the chair and the vice chair here in the chambers if everybody else wants to zoom in, since we are asking for department heads to do that. We are here to give service to our public, so I think we need to be making sure that we are doing our due diligence to make sure we're taking care of our employees. So department heads need to be looking at what they can do to keep their offices open but their employees safe. So at this time, with the variant spreading, definitely, we need to give direction to the department heads to be looking at seeing who can stay home, but continue to be able to have the public have access to everything. Because we know if it goes through a department, then that department's going to have to close and we will have no services going to the public. So we need to be making sure that we are taking care of things in the future.
Thank you, Vice Chair Scott. Supervisor Sabatier.
Thank you. I feel very adamantly that this would be a mistake. I think this would send a message to our community that number one, we have not learned anything over the course of the last 2 years. There are ways to protect ourselves, and it's worked. And I think that if we start, then what's next? And I don't want to send that message out. I would also suggest that being, in a weird analogy, captains of the ship, that we should ask people to work from home first before we close down our offices. I think it's a very strange perspective to say, please keep working at minimum, but we're not going to be here because it's not safe for us. And I think that is also a bad message to send to our employees. I think we know about social distancing, we know about masking, we know what the vaccines are capable to do in boosting protection, and I think that we utilize that knowledge and we ensure that we provide a safe space here and continue to do the work of the people in the ability for the people to come and confront us in public, face-to-face, which I think has a very drastic difference than only hearing the public from Zoom. I think Zoom is not a replacement for what it is that we do. I think Zoom is a great addition to what we've done. But going backwards, I think, would send a very bad message to our community and create a sense of fear in what is happening. And I don't think that is the case, and I don't think that's the message that I would like to send.
Thank you, Supervisor Sabatier. Supervisor Simon, do you have anything? Or go ahead.
You know, there we go. At this time, you know, I absolutely agree with what already has been said by our other board members at this point. I do want to focus on the remote working opportunities that we still have for our departments as we traverse these next 6 weeks or 8 weeks or whatever it is. It seems like it's going and coming. So at this point, I'm in complete agreement. We have talked about these issues before, early on during the pandemic, about social distancing here for ourselves at the diocese, as we're doing today. And then the opportunity, I know Supervisor Scott brought up remote opportunities for a portion of the board. So I think we have those. I guess that would be a question too, Anita, going forward with the findings we do with the resolution on a 30-day basis. We could find those if we need to do that for limiting our participation, especially with large items, because you know, my thoughts are, I know coming up, obviously there are always lots of things that interest folks and they attend on Zoom, but some people like to come in and there's going to be some issues we deal with coming up in the future to limit opportunities, you know, with the numbers in here to do that. So.
Yes, if, for example, you think you're going to have a lot of people and you want to further restrict the numbers in the chambers and then correspondingly restrict the number of your board members present, you can do that. It would be hard to just do that and without those kind of restrictions, because if the public's not here, the risk to you is pretty much addressed by your spacing as you're doing today. But that's up to you and what findings you make. But the resolution that you've already done and reaffirmed today allows you to make those adjustments in a pandemic as you determine the needs of the community and the needs of county employees, the public, and your own needs justify.
All right, thank you, Anita.
And I just wanted to make another comment on the work from home policy. I think if department heads will be sending employees home, they need to make sure that the proper documentation has been filled out, that we know as a county what has been brought from, you know, computers, whatever has been brought there. We need to make sure that they have a safe place to do their work. I know there's been issues with applications being put in where we don't have that picture of their workspace. We need to make sure that if they are working with documentation that is private, are they in a space where that will not be shared? We also have to make sure the department heads are keeping up on their employees. It's not a free-for-all. If you send an employee home, we need to make sure you're checking up on them and making sure that we're getting the work done. And if it's not working for that employee to be working remotely because they just can't seem to be able to continue doing the work, then maybe rotate and have somebody else do that. But we have to make sure that productivity's being done and the public's still being served.
Thank you, Vice Chair. Yes, I really agree with everybody here when it comes to the remote work policy. I think that leaving the department heads, ensuring that they remember their authority when it comes to this situation. I've kind of been a proponent for this since this started, and even before, making Lake County a more lucrative area to work in, just having those type of options for morale. I mean, we can only offer so much when it comes to wages and whatnot. But having that option in certain instances helps with people deciding, hey, I'll work in Lake County, or I won't move to Napa, or I won't move to Mendocino because I can work from home sometimes, as long as it's productive and there's a way to measure it. As for Zoom, I don't have a problem doing either or. I know that as the chair, I would still come in and do this from here if need be, or if we decided to do Zoom from home, the full board conducts Zoom from home. I'm fine with that as well, as long as, you know, if we're trying to prepare also for lessening the chance of anybody getting sick from this situation, this surge, and what's going on. I do as well know that this has been very rampant in the area, in the district, with different people, family members, despite even being vaccinated. So I know that I would not mind if the board seen fit to do so. I would, however, of course, not prolonging it, but addressing it each week or every 2 weeks or something of that nature, or even limiting high volume items on the agenda in chambers if we needed to. So I'm open to those. However, of course, if the board decides, then we'll go from there. I'm fine either way. But I worry because our staff is our only staff. And we know how hard it is to bring them, to recruit and retain people. And so once they are homesick and others are homesick, and I'm pretty sure other department heads and different agencies in the county feel the same way, like what happens when there's nobody to take care of the sick or take care of the people or their issues because they're homesick. So I really want to be cognizant of that. And is there anything else to add, or I should go to public input, shouldn't I? I see there's no one in the room, so we'll go ahead and move on to Zoom, where we have Betsy Kahn. Betsy, you have 3 minutes. Are you there, Betsy? There.
I'm sorry.
There you go.
Okay. Thank you. Thank you, Mr. Chair. I have 2 questions and 1 comment. My first question is, are you supervisors and staff present in the area that you talked about, the 7 people? Are you testing yourselves every week before you come into the chambers? That's one question. Are you doing that? Secondly, for those employees that I believe CAO Hutchinson said there's a less than 50% vaccination rate for the employees. Are they required to test before they come in to work every, once or twice a week? I don't know if that's being done or not. And then the third thing is, Supervisor Sabatier said that he has the impression that people who come to the chambers in person make a greater impact. I'm just paraphrasing, the people that are in the room physically make a greater impact on you in terms of providing comment. I personally find it very difficult now to travel. The ability to provide this comment or any other comment in your meetings remotely is extremely important to me and to the people I work with. So just my 2 questions are what I would like to hear about, please.
Thank you, Betsy. CEO Hutchinson.
Yeah, Mr. Chair, if you If you'd like me to
Yes,
address.
please.
I think I can address 2 out of 3 of those questions. And so the first one is, are all of us testing before we come in here each week? I am aware that some of us are testing when we have reason to do so, if we feel that we might have been exposed, but I'm not aware of anybody testing weekly on a regular basis just for the sake of testing. And then the question about our employees testing, as noted during the prior discussion, the prior agenda item, we're still formulating what our rules will look like around that while we await Cal OSHA's interpretation to the Biden vax or test mandate. So employees are not regularly yet, but that may be coming. Some are, yes. Yes, Anita's reminding me there are some required categories of employees that are now, certain employees at behavioral health and certain employees at health, but the entire employee base, not at this point. And Supervisor Sabatier may want to address the comment about Zoom versus in person.
Yeah, just as a perfect example, as you're talking, Ms. Khan, I can't see you. And I think that the body language is just as important as the verbal language and really conveying a point. We hear you, and I love it. I don't want to get rid of Zoom. But there is a huge difference in having a physical person here who's advocating for one direction or another for us to vote on versus just on Zoom. It's almost like the difference between 2D and 3D. I think that while we have to take the precautions that we need to take at this moment in time, it doesn't change the human interaction that a face-to-face will offer.
CEO Hutchinson, go ahead.
So, Mr. Chair, I don't know if there are additional public comments or if that was the only
I
one.
seen Pam had her hand up. I didn't know if you.
I think she took it.
Yes.
So, oh, okay.
I just wanted to say that we have provided the departments with boxes of testing for employees that would want to test if they came in or weren't feeling great. So we have them available in every department now with those bigger boxes of 40 tests, and we have been delivering some of the individual tests for departments and employees to use so that we make sure that is available to them.
Thank you.
So, Mr. Chair, then to summarize my understanding of what I'm hearing from you today, clearly there's no consensus to close the chamber, so we understand that won't be happening. But in terms of instructing the department heads to use their authority for remote work, what I'd like is your consensus that I write a communication to all of our department heads, reminding them of that, encouraging them to use remote work now where it can be effectively used. And hopefully those employees have completed the requirements of the policy for remote work, getting approval for remote work, which includes some of the requirements that Supervisor Scott referred to, and if they haven't, telling them that they need to do that as they send employees out to work remotely. And the other thing I wanted to touch on is, you probably recall that there had been some informal discussions about when things were better to require that management staff be in the office a larger portion of the time than non-management staff who may be working remotely. And I'd like to clarify that at this time during a surge, that type of language would not be expected.
I think it looks like we have a consensus.
I'm okay.
So then secondly, what would you like to do regarding your governance workshop on Thursday when we know 20 plus department heads would be coming? Should we could instruct them to join by Zoom. As Supervisor Sabatier was describing though, the quality of the content probably won't be as good as it could be if we were all in person. But my concern is if we bring them in here, we won't have any space for anybody else. So I seek your advice on that.
Supervisor Sabatier, and then Vice Chair.
I'm going to pause. I think responding to the question right now is more important than my comment that I had, just to continue the conversation rather than breaking it up.
Go ahead, Vice Chair.
Well, I was going to make a comment about the department heads. I think it's different too if we were to be able to see the department heads than just hear their voices. So I think if we do have them come in via Zoom,
With
we need to be
camera.
able to, yeah, we need to
Okay,
just be able to.
so require cameras.
Yeah.
Yeah, fair enough. Is there consensus around that? So department heads would be in Zoom, the 7 of us and any public that's in attendance would be in here. Department heads in Zoom with camera. Yes?
I'm fine with that.
I'm in somewhat agreement, I guess. I'll be the one that brings it up. I mean, as we talk about going through the Omicron variant and we're looking, what it showed across different countries, other places it's hit, it kind of goes up, you have the spike, and then it starts to come down after a reasonable time. So I guess the question on the workshop would be, do we need to have it on January 20th, or could it be moved to March 20th? Just a question. I will put that out there. If we talk about timing as we're dealing with these things, because, whether it's on Zoom or a phone call or a letter, we'll try and really respond to all of our constituents that come in and give us public comment or other things kind of in the same manner. So I put it out there. I'm good either way. But yes, definitely, if they're going to be on Zoom, we need to be able to make sure that they have a camera available so they can be seen as they're making their comments. But I do bring it up with rescheduling if that is, something we're dealing with. And I think as we move through this Omicron variant that is working its way across the country, and that we consider those options too. So I put that out as just a comment.
Yeah, I agree.
You could look at rescheduling, but I'll just remind you of what the intent was in scheduling it in January. It was really intended to have that discussion with department heads before they start formulating their budgets. Budgets for the next fiscal year are typically due around April 15th. And so that was our sense of the timing.
And any other year, I completely agree with it. But we are in a pandemic, and we need to be able to move in that direction with the stuff that we have learned, because I really appreciated Supervisor Sabatier's comments of what have we learned since the pandemic started, and implementing those decisions to help us move forward, I think, are always important. And we've all learned. I am not a public health doctor. I did not go to school to be a doctor, ran for office to help, and that's what I want to continue to try and do. So I bring up those conversations and options that we do have. I think in 2023, that would be the plan, to be on a normal schedule with the state of the county or an update, which is excellent. So, yeah, fingers crossed. So that's just a comment I wanted to bring up on these conversations.
I think it's a good comment.
And so if there's interest in postponing, what I might suggest is that you take action by motion to postpone today, and then we can have an agenda item on the 25th after we've had an opportunity to look at calendars and come up with some proposed dates. So you can select, because remember, it was difficult to get the dates, and so you could select dates based on your availability on the 25th.
Supervisor Sabatier.
So going back to and I agree with doing that, and I hope that that's the direction we will take, is to postpone. And I appreciate the comment made by Supervisor Simon, because we have to be adaptive to our current situation and status. But I want to go back to the remote work. I know that certain departments, it's easier to do that than others. And so I think that making sure to give the power to our directors to make the best decision for the best needs of their department in order to keep the health of our staff in mind. And it's not just our correctional officers or our law enforcement officers, it's also some of our financial folks who have to be in the office to get some of the stuff done as well. And so I think that we shouldn't tell them to do those things. It's to remind them that it's available and to use it as much as they can for the best for their department, rather than pushing them to say, please, let's vacate, because we can't. It's not possible for some of these places. So I just want to make sure that it's, I wanted to make that statement.
Supervisor Simon.
Yeah, To that point, I know that it's great when we convene the department head meetings. It was brought up by Sheriff Martin. I think there's one coming up too, just to continue to do those. And I really enjoy the way that it's rotated throughout the board. It's not a committee that, is set up. It's the department head meeting has, and then a different supervisor each time besides your chair is asked to go. So I think those are good communication ways to know that that support's there. And if something needs to come back to us, we can do it at that point. So just want to talk about that also when you're talking about giving our department head support in the different aspects that they serve the community and their job responsibilities.
Supervisor Pyska, you good? Oh, I thought I seen it. I'm sorry. I should have put my glasses on.
So it was always only my intention that department heads just be encouraged to use it according to their own judgment, not telling them to do it. And so it looks like I would be telling them, first of all, that the January 20th workshop is postponed, date to be determined on January 25th, and to encourage them to use remote work, to make sure they have the proper documents in place for that, and there's no special requirement for management during this surge time.
It looks like that's the will of the board, and I now can feel the same pain as the previous supervisors who's had to postpone one of their workshops because of the pandemic. Of course, this is real world, and it's just what it is. I did have a question though, Ms. Grant. The town councils max within the county, should we follow the same type of, how would we address that? I mean, I just want to make sure, because I provided Zoom for mine, and I'm pretty sure others have done theirs. I'm not sure, but, or just limit the activity or people coming, or?
Well, when you have these small community groups, and certainly the pandemic is ongoing, so the enabling event, the disaster, the pandemic, it remains. The law now allows that you can do it this way, you can do remote. The difficulty becomes to do a partial and to have inconsistencies in treatment. So that's why I said, for example, if your board wanted to reduce the number of your board members, it would be because you were also reducing the public so that you could have a greater expanse of distancing. For your little districts or your little town halls, it's a smaller group, but it often has very large public attendance, I've seen. Yeah. So Zoom does make sense during a surge, and all they have to do is make the finding. And I can give you that language if you don't have it. It's the same as, essentially the same as what you've done before. But they make the finding that because the pandemic exists, they're experiencing a surge, and safety to the public and to the board members of each of these town halls.
Oh, so I can give it to them and let them, okay, that works.
Yes, yes. They actually, because they're completely board appointed in this regard, they can act under your umbrella, your board's umbrella, but I think it's a good idea if they make those determinations. But it's a reasonable determination under these circumstances. And again, those groups end up having a great deal of public participation, and that alone would justify trying to provide some distance.
Thank you.
Yeah. I'll need that language too.
Yeah.
I'll send it out to everybody again.
Okay.
And then I have a question then about our evening meeting. We're all planning on squishing into the Lakeport chambers. Would it make more sense to have our board meet here and have the Lakeport chambers meet there and have public, or would that just be too complicated?
You could, because we will have the chambers fully operational. If you'd like to do that, you could stay here. Before the surge, of course, we were thinking that energetically it would be great to have you all in the same space. But maybe not in light of the circumstances. I don't think Susan Parker is in the room right now, but she was working with Kevin on the setup. Perhaps I can get her to dial in and answer any questions you might have about what the plan was to set you up in
that. Might be good. It maybe because Supervisor Simon and I are on the committee for the annexation, maybe it would make sense for us to be at that chambers, but not all 5 of us. I don't know, just for spacing.
And it was expected that, Susan is going to be presenting on behalf of our office, so she was going to be physically present, and I was going to be here for the same reason, because I know there's only so much space over there. And we anticipated that you and Supervisor Simon, as our negotiating team board members, would have some initial comments as well. So let me see if I can get a hold of Susan. Normally she's in here, but I do not believe I see her.
Because I do believe we will have a large public present at this meeting tonight, just according to the phone calls I've received.
I see.
So what you might do, because it might take me a minute to get a hold of her, maybe you want to do your calendars and come back and then, oh, yes, there is the air quality item, so sorry. So, yeah, maybe you want to move on to the air quality item, and we'll come back and finish this up.
All right. So we will, in the meantime, move on to 7.4, sitting as the Lake County Air Quality Management District Board of Directors. Consideration of agreement with Mendocino County Air Quality Management District for air pollution control officer services. And I will go ahead and give the floor to the director.
Good afternoon. This is Doug Hart. I'm the Air Pollution Control Officer for Lake County Air Quality Management District. And I'm bringing this as we're not actually considering an agreement yet, but I've been asked to consider entering into discussions to form an agreement with Mendocino County. Their Air Pollution Control Officer had to retire early due to personal reasons, and they are short-staffed and they are in significant need of assistance. So they knew about our agreement that we've done with Calusa, and we're looking for a similar type service to see if we could help them out as well.
That's why we had it.
The issues that we'll have, this will be a little bit different than what we did with Calusa. Calusa was, just needed someone to officially sign documents and things, and this will actually involve a lot more time and probably some travel to, some time out of county and in Mendocino County, assisting their staff with some tasks. So what I'm asking right now is for the authorization to have those discussions and bring an agreement back to this board for approval if that's an appropriate next step. But I wanted to make sure that you kind of knew what the scale of it was and get approval to provide, be able to provide more assistance than we would, normally provide under just our general program. So.
Thank you, Director Gearhart. CEO Hutchinson?
And to add,
Your microphone.
As your board is aware, we've done cooperative arrangements like this in the past, most recently with Calusa County when we loaned both our ag director and our air quality director. And so, and it's happened before in other circumstances as well. So happy to work with the other county on a short-term basis. And so today what's being sought is really the authority to have those negotiations, and then I believe later an agreement would come back to you for the terms.
Thank you. And Supervisor Sabatier, you have your, yep, there you go.
I appreciate that this comes to us, and I understand why this is a pre-conversation, because the list, in my opinion, I almost feel like it's a little rude. Personnel evaluation, I mean, why would they ask that? That's just weird to me. Weekly meetings, like, you have to admit when you're asking for help that you're asking for help and not trying to take advantage of the help you're getting. I think that you could be of service to them, but some of the things I see on the list, that is an abuse of asking for help. In comparison to what we've experienced. We need you here. We appreciate what you do here in Lake County for the Air Quality District. I appreciate the fact that you are bringing the conversation, because obviously you would like to help with Mendocino, and I want to help. But some of these things I want to cross off entirely and say, look, if we're going to go in negotiations, personnel evaluation just seems like a little stretch for somebody who's walking in as an interim while you search for somebody to be permanent. Weekly meetings and then saying bi-weekly meetings, that could be done via email, things like that. And so I just think that the list looks a little absurd to me in comparison to what the real ask should be. So that's it. That's my.
Thank you, Supervisor Sabatier.
And we can certainly address those kind of concerns, and in fact, we can look back at the agreement we used the last time we did this for Calusa County because that agreement was acceptable to your board, and try to narrow it down to the tasks that are truly appropriate.
Thank you. Director Gearhart, you had your hand up. Go ahead and.
Okay. I was just going to mention that the list was a very rough list of the items that were coming in the future for Mendocino County. So it wasn't a specific task list, but an example of some of the duties that are coming up and that they have to figure out how to deal with. So we didn't spend any time really going over any of these things. It was just kind of, this is really just a potential list of things that were coming.
And
I appreciate what you're saying.
I read it in that way as well, and I just want to make sure that that to me it just seems like a stretch, an overreach of a request. And some of those things to me, yes, I would love to help, but some of those things to me need to be crossed off. That's just my opinion. So I approve going into the negotiations and looking at what kind of agreement can come out of this. But I want to make sure that we are only helping and not doing the job entirely for them, because we still need you here. And I don't want to overburden you where you get burned out.
Thank you.
Got it, supervisors.
All right.
So we'll return with an agreement that.
Or at least that was just me.
So it doesn't look like we have any more comment. Do we have anyone from the public that has anything they would like to add or has a question, comment, or concern on this? I don't see anyone in the room coming up, so if there's anyone in Zoom, all right, we will bring it back to the board for action.
We're just seeking your concurrence that we move forward with negotiations. So I think you can just do that by consensus or motion, whichever you prefer.
I think it looks like we have a consensus. Yes.
Okay.
So we'll move forward from there.
Thanks, Doug, for your patience.
Thank you.
Thank you, Director Gearhart, for your help.
So since Susan Parker has landed in Zoom, thank you, Susan. We're pulling you in on short notice, and I apologize for that. But the board has been discussing the agenda item that I put on the agenda about possibly closing the chambers to manage, to promote a safer workplace during the surge. And while there is not direction to do that, there is some concern about board meetings that involve a large number of people present in a single room. And so the concern has come up about the meeting tonight at 5:30, and board members are thinking that it might be safer for some of them to remain here in the chambers. We had intended to keep the chambers open anyway for overflow because we anticipated the public attendees might also exceed capacity over there. So can you tell us, I know you were working with Kevin, what were the plans for spacing people out over there at City Hall tonight?
Well, we were going to spread both of the boards out over the dais and on the tables up front, similar to what we did with the previous meeting we had down there. And so I don't see it as an issue at all, really. I think we can accommodate both scenarios as far as having the board both at the chambers and down at City Hall. I really don't see it as an issue because we've already worked on the the telecommunication aspect of it. So I think we're good to go.
And so conversely, do you see it an issue if some board members decide to remain here?
No.
Because the teleconferencing issues, the meeting was also taking place in the chambers with all of the same connectivity because we were anticipating overflow public. And so if memory serves, I believe possibly one member of the city council would be participating by Zoom anyway.
Correct.
So it wouldn't seem unusual, I think, to have some of our board members physically present here but connected to the meeting by Zoom.
I don't believe it's an issue at all. In fact, before we even scheduled this meeting 3 weeks ago, we were thinking it would be almost a joint location just because we were concerned about a possible surge. So I really don't see it as an issue.
Thanks, Susan.
Supervisor Sabatier?
I was just going to mention that there's already council members. I thought it was just one, so I guess I learned something, but that there's already access to Zoom. So I don't think it's anything bad if any of us decide to join via Zoom rather than being in person. So.
No, I really don't. I mean, it's just inconvenient, and, but I don't see technically or otherwise it's an issue.
So my recommendation would be that we have present over there our chair, of course, because he'll be co-facilitating with the mayor, and then also our 2 supervisors who have been on the negotiating team.
So I would attend over at City Chambers? Okay.
That's a suggestion.
I was just going to make a statement. I plan on being there. I think this is a collaborative, historic moment. I think we could do it safely. And if it feels like it's not safe in the room, then at that point I can just walk away and join in via Zoom. But I'm planning to be there in person because this is a historic moment.
Okay. Okay, looks like we're going to go. Yeah, after that.
Yeah.
All right, thank you, Susan.
All right, thank you.
Thank you, Susan. Did I opened up for public input on this item? I think so.
You did.
Yeah, and so, okay, looks like we can
I'm sitting here.
move forward from this item back to our calendars.
No, I think we still need to
Supervisor
make a
Simon.
motion. I am prepared to make a motion to postpone the workshop meeting on the 20th and look forward to.
That's right.
being brought
Thank
back
you.
on the 25th. So I move to postpone, well, I'll just say what I just said, postpone the workshop that we had scheduled for the 20th to be returning and have it returned to us with a date on the 25th or a suggested date in the future for the 25th agenda for our board to consider.
Second.
I have a motion and a second. Johanna, please conduct the roll call.
Okay, Supervisor Simon,
Yes.
Supervisor Sabatier,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Crandall.
Aye.
Thank you.
All right. Thank you. And so it looks like we are back to, I think we're at calendars, am I correct? I'm trying to open it up. Yep, we are. So with that, we'll start with Supervisor Sabatier.
Thank you very much. Later on, there's a much-needed lunch. Then we'll have our board meeting over at Lakeport tomorrow. For some reason, I thought I had something. Maybe it disappeared. But it looks like I got nothing on there at this moment in time. Starting Thursday off with Judge's Breakfast. If they reopen, at this moment in time, it is postponed until further notice. I am meeting with, later on that day, with the City of Clear Lake, BLM, CAL FIRE, and our local fire districts to discuss control burns east of the City of Clear Lake. That was something that was supposed to happen. And just to let Supervisor Pyska know, I will be bringing up the Canocti area that was supposed to also have some, I believe it was control burns more so than vegetation removal last year. That was not able to happen because of equipment failure, and so I will bring that up just to kind of check in and see where they are with that.
Which meeting is that again?
It's a meeting that I've coordinated together just to check in on what's our status. Are we going to get it done? They were still working on NEPA last year, which is why we did the vegetation abatement. Beautiful up there, 400 feet wide, all between the Rocky Fire Scar and the City of Clear Lake. But I know that Canocti was on their list last year of things to do as well, and they weren't able to accomplish that. So I'm going to check in with them, see what the status is, and I'll make sure to keep you up to date with that and who it is that I'm speaking with. Later on that day, I have a meeting with FEMA after the fire has invited me to speak with them about our experience with the Cache Fire and also what are our requests for potential change. Just to let you know, some of the requests that I will be asking is to have a sliding scale on disasters. For example, if we have a community that has less than 800 houses, we still don't meet the entire threshold, and yet we can lose an entire community. We really need to look at what is the size of the community, what's the poverty level of the community, because the ability to recover if you're a small community and poor community is so much more difficult than if you are a large community and a more affluent community. And I recognize and appreciate the recovery efforts that have occurred when you go visit Coffey Park, but there's a vast difference in the demographics of the population in Coffey Park versus our population that has been unfortunately displaced by many, many fires. So hoping to have a good conversation and to be heard Then later on that day, I have a call with CSAC, and I will be meeting with, looks like I have a meeting with Jennifer Baker. I'm wondering, is that for the syringe exchange? Is looking at CAO Hutchinson. Not really looking, but I'm trying.
What time of day is that again?
It's at 4 p.m. on Friday?
Yes.
4 p.m. on Friday. Yes, that is the syringe exchange program meeting.
And then on Saturday, I'm going to be going to the, I believe it's on this Saturday, yeah, the 15th, the Lions Club, who does our 4th of July festivities and always is doing work within our community, scholarships included. We'll be doing a crab feed, so I'm going to be joining them for that. And then looks like we're moving our governance workshop, so probably not going to meet with our CAO since we got nothing on Tuesday. LAFCO meeting on the 19th, an AVA meeting I have. Is that correct, that we have an AVA meeting? It seems like we just had one.
No.
Okay. It's just on my calendar for unknown reasons then. Let me delete that. And then joining the City of Clear Lake for a marketing committee meeting where I'm still continuing to work on more artwork coming up into the City of Clear Lake. Past that on Thursday for the special board meeting, and then joining the City Council for the City of Clear Lake and listen in on all the stuff that they got going. And back on the 24th, meeting with our CAO, a Roadmap Task Force meeting to continue the project that we started last year over in the Clear Lake Oaks area, and then meeting on the 25th. I do want to mention at the very least, I have been having discussions with all of our fire districts. Just met yesterday with our two hospitals, along with CAO Hutchinson for both of those meetings, and trying to rectify something that was brought up by Dr. Pace this morning about the lack of ambulance service to take us out of the county. That is something that is definitely on our radar. It's definitely something that we are putting our head down to bust through all the barriers that have prohibited us from finding a resolution to the problem. My goal is to bring something back to the board, hopefully by, and maybe it doesn't require to go to the board, depends on the avenues that we choose, but hopefully by early February we'll have a resolution for that. It needs to be solved yesterday, but it's something that is definitely on our radar, working with public health, going to have a conversation probably within the week or so with our new public health director, just to make sure he's up to date and apprised of all the conversations that we've had. But just wanted to make sure that everybody was aware that that is being worked on. It's of concern. And it gets harder because there's staffing issues both on the fire district level, there's staffing issues within the hospital levels. It just exacerbates the problem. So again, that's it for my...
I would just like to add, that's a committee assignment that we're actually working on too.
Yeah.
That's. Okay.
Supervisor Pyska?
Yeah, so this evening's meeting with the City of Lakeport. Wednesday, or tomorrow, I have CDD committee. I'm meeting with someone at 1. I'm hoping to watch the Water Resources All About Clear Lake Hitch meeting in the evening at 6. Thursday is a Fire Safe Council, but I'm also trying to coordinate a meeting with the force specialists that I did the helicopter flyover with. They want to come back and get up on Mount Konocti and kind of check out on the ground what's happening. So I'm trying to coordinate that with Lars to get up to the top, and then also BLM to get out and check on that tree mortality on Mount Konocti. So that's, hopefully that's happening, but it's not confirmed. Friday, the weekly meeting with CWMP. Then I'm going to be in the afternoon with Todd Metcalf. I'm finishing my tour of orientations. I still have a couple more weeks left of that.
Only a year in.
Year 2. But it's really great. This is my chance, my opportunity to go out and see the facilities, and hoping to meet staff, but likely won't see very many. around. On the 10th, I have my weekly meeting with Carol. Oh, wait, wrong, 17th is off. The 18th, we have our health director committee meeting. The Middletown School Board meeting's been changed from tomorrow night to that evening, the 18th. Wednesday, the 19th, meeting with, who's that? Oh, that's at Canuck Christian Academy. Then I'm going to be meeting at Reynolds Systems in the afternoon with Rick Reynolds. On the 20th, we don't have our meeting now. We've postponed it, but we do have Disaster Council in the afternoon, and we have the I have the Cauberry Council in the evening, which they've elected to go back to Zoom. On the 21st, weekly meeting with CWMP, and then I'm going to be meeting with Pam Samek and Gail Woodworth. Those may be the last of my orientations, hopefully. The 24th, I'll have my meeting with Carol in the morning. Supervisor Simon and I are having a meeting with Mike McGuire and Cecilia Aguiar-Curry to talk about the tree mortality. I'm really spending this time right now before that meeting, gathering up as much as I can, reaching out to anybody that kind of dealt with this issue in the last drought, trying to gather up everything so that we have a strong case for what our plans are and what our needs are when we have that meeting. And then in that afternoon, we have our CMAT meeting and then RRA, and then back on the 25th.
Supervisor Pyska, for the tree mortality, we are meeting in the Wildfire and Forest Stewardship Ad Hoc Committee meeting this Thursday. We're meeting with the USDA Forest Service.
Mm-hmm.
So I don't know if you have any questions you can give or provide for me like that you would like to ask maybe. And I figured I'd ask now that we're in public so that way it's not a Brown violation. Is that okay, Anita? Yes, okay, good.
So one of the things, and I was emailing back and forth with Sheriff Martin yesterday about a couple strategies. Right now I'm just spitballing strategies, trying to figure out, what could possibly work. And one of the ideas I kind of came away from those emails was maybe we have to have the overarching strategy for our county. We can develop these different programs that I'm kind of working on, but they're small. They don't apply to everybody. So small landowners, large landowners, BLM, National Forest. So I guess that's my question is, were they working in partnership with other counties in the past drought? And what were the best practices? Did other counties come up with a kind of overall strategy?
And Mr. Chair, excuse me, but you can raise the question, but you really can't answer it consequent to your calendar. So, but it would be a great agenda item.
Yes.
Yeah.
Okay.
So, sorry, I went off tangent, but those are my questions. And
Well, at least everybody knows you know what you're talking about or you're trying to. Sorry about that. Thank you for getting us back on track, Anita. Supervisor Simon.
Finishing up today's meeting, and then heading to Board of Supervisors meeting tonight. And I did plan on going over to Lakeport, so I'll be over there. Tomorrow morning, CDD committee meeting with Supervisor Pyska and the rest of our committee. And then Thursday, obviously, things have changed. We have the Middletown Area Town Hall on Thursday evening, which has been in Zoom, and they've continued to do that. On Friday, I have, in the morning, I have a meeting 10 a.m. And then at 8 to 10, and then at 10 a.m. I have our weekly planning meeting about the home hardening program that we've been working on with Supervisor Pyska, which is moving forward. Monday, obviously, is a holiday, so we have pushed forward our Risk Reduction Authority meeting to the 24th. Wednesday, the 19th, I have LAFCO, Thursday afternoon. On the 20th, we have the Virtual Disaster Council meeting, the first one of 2022. 21st, I have the Executive Committee meeting with LTA and APC, talk about the Renewable Energy Program. We've got to get back to on, and then at, once again, the weekly planning meeting. On the 21st, I have something else on the 21st that I missed too. And I lost it. So, and then back here on the 24th, I have the CMAT meeting, and I also have the meeting with Senator McGuire and Cecilia Aguilar Curry too. Correct? Both those folks on that Monday, and then later on in the afternoon, the Risk Reduction Authority meeting. And I will find the other 21st meeting I have. So move on.
Okay, excellent. Vice Chair Scott.
Yes. Let's see. Tomorrow looks pretty clear, so I'll just be answering emails and phone calls. On Thursday, I will be attending the CSEC events training from 9 to 1, and then I'll be going to the Mental Health Advisory Board at 3. And then, oh, hold on, everything moved. And then on Friday, I have Blue Zones at 10, and then Jennifer Baker at 4. Martin Luther King's on Monday, so my family and I, we always go out and find an area to clean up when we pick up garbage that day, so we'll be doing that. Tuesday, the 18th, Mendocino College semester begins, and I have a meeting with the new PH committee meeting at 9, and then attending the city council meeting here in Lakeport at 6. On the 19th, I have a meeting with Canocta Christian Academy and Supervisor Paiska. I'm hoping to move that till 9:30 because I have agenda review at 9 that I want to attend. So I know I put an email out asking that, but I haven't heard. And then on the 20th, I will be a panelist for the Women in Law Enforcement Summit. We'll be picking one of our women that are in law enforcement here in Lake County and sending them to DC for the summit. So I'll be doing that. I'm excited for that. And then on the 21st, I'll be talking, I have a meeting with a constituent at 10 o'clock talking solar. And then Monday getting ready for Tuesday's meeting.
Thank you. And I'll go on to my calendar. Today, of course, we'll go over to the city chambers and conduct our 5:30 annexation meeting. Tomorrow would be, no, tomorrow wouldn't be not agenda review, not till next week. So I have the RCRC at 9 a.m. It's via Zoom. All RCRC meetings are, we were having an installation of officers, was scheduled for tomorrow night, but that will be postponed till March, I want to say. So in the meantime, everything will be conducted via Zoom. So that will be the RCRC meeting tomorrow. Thursday, the Ad Hoc Advisory Committee on Wildfire. That'll be in Zoom as well, what I had mentioned earlier. 9 a.m. on Friday, a MediaCom presentation for Spring Valley was scheduled, so I'll be doing that. On Wednesday, the 19th, agenda review will be conducted that day. I see that we have a Golden State Natural Resources Committee, and I think that has been pushed over from tomorrow to that day for RCRC as well. We'll have a 5:30 Worth meeting in Upper Lake. And then on the 20th, right now, what I have is Lath. I have to find out if they're having that meeting. I know that the previous chairs is in the hospital and had sent out an email to cancel the meeting, so I have to find out from the other committees and committee members, and I think most of them feel as if they're going to cancel it, but I want to make sure, so it's still maybe happening. If not, if it doesn't, I know for sure that I'll be going to the monthly packing party here in Lakeport for the Jenny Craven conducts it. It helped me with the name. It's yeah.
Tango Mike?
Yes, yeah. So I'll be doing that. 8:40 a.m. on Monday, CAO meeting with Carol for the meeting for Tuesday, and then the 4 p.m. Roadmap Task Force. So that's what I have. Is there any? No, there's nothing else. So let's move on to what is it? Closed session, which will be Public employee appointment pursuant to Government Code Section 54957 Bravo 1, or B1, sorry. Interview of agricultural commissioner, appointment of agricultural commissioner. With that, we will go into closed session. Time out. You want a break first? Okay, we'll take a break.